Good morning, everybody. May I invite you, please, to stand, Miss Skylar Thomas. She will be doing for us the territorial song, and in appreciation, thank you for standing. Put your hands together for Miss Thomas. Miss Thomas is fresh from her world tour, and so we're very lucky to have her with us this morning.
Out of the huts of history's pains, our ancestors bled and died. But with strength and willpower we overcame to restore Virgin Islands' pride. To preserve our beauty, we devised a plan to retain ownership of this precious land. Educating your people is the golden key to maintain the success of this territory. Oh, how radiant are your daughters, and how wealthy are your sons. Your beaches boast your beauty, and your success is second to none. Green and brilliant are your hills. And your qualities can never be denied. May God richly bless this territory. May we ask three things of thee. Courage for all great leaders, that they may rule our destiny. We ask for wisdom for our people, that they may live in harmony. Second to none. Green and brilliant are your hillsides. They replenish our hopes and pride. Oh, beautiful Virgin Islands, your qualities can never be denied. Oh, beautiful Virgin Islands, your qualities can never be denied.
Thank you so much. You may be sit down. At this time, it is certainly my pleasure to welcome our chairperson for today's engagement. Please put your hands together and welcome the world-renowned Miss Zoe Walcott.
Good morning. Good morning, everyone. And true to form, you know why we're here today. And so I'm going to already let you put in your steps. So I'm now going to ask you to stand again. And I'm going to ask for President Violet to come to the podium to open with a word of prayer. And then we will officially start.
Thank you, President Zoe. Good morning, everyone. Let us pray. Gracious God, we thank you for the gift of life and for the minds, skills, and dedication of those gathered here today. As we begin the symposium and panel discussion, Lord, grant us wisdom to our speakers, clarity to our discussions, and insight to our learning. May the knowledge shared here advance healing, innovation, and compassionate care for all those affected by cardiovascular disease. Guide our time together, and may our efforts and that of our healthcare professionals ultimately serve the well-being of humanity. And this, Lord, we pray in your holy name. Amen.
Amen. Thank you so much, President Violet. Once again, a pleasant good morning to each of you. As we welcome you to Matters of the Heart, the Cardiovascular Symposium 2026. Today, we guide you in terms of how to listen to your heart, and more importantly, our panelists will tell you what it is saying. I recognize the Minister of Health and Social Development, Honorable Vincent Wheatley. Please feel free. He wanted that applause. Stand again, please. You're putting in your steps. We appreciate. We recognize President Dr. June Samuel, the acting CEO and president of Rotary Club of Roadtown. Dr. Roger Miller, Doctors Andel Emery, Doctors Donald DePet. I apologize if I mispronounce any of the names. President Violet Gall of the Rotary Club of Tortola. President Faye Smith Penn, Rotary Club Sunrise of Roadtown. I also recognize myself, President Zoe Walcott of the Rotary Club of Central Tortola. The doctors, nurses, health practitioners, Rotarians, presenters, once again, a pleasant good morning. We're going to jump right into it. And at this time, I'm going to invite President June to come and give the official welcome. Put your hands together and let's get those hearts pumping.
Good morning, everyone.
Good morning.
So thank you so much for being here this morning, Saturday morning. I know sometimes it's a little difficult to get up in the morning on a Saturday, but this will be well worth your time. Thank you. Yes, thank you so much. I can I'm promising you it will be well worth the time spent. So I acknowledge the protocol already established. And as President Zoe said, I am June Samuel, and I'm here in a dual role today. I'm the acting CEO of the Health Services Authority, but I'm also the president of the Rotary Club of Roadtown. Yes, the funnest club on Tortola. So my job today is to just say a warm welcome to you on behalf of both BVIHSA and the Rotary Club, Rotary family. And we have embarked this year because our district governor, Bill Aiken, who I hope will pass through later today, he envisioned that we should pay attention to cardiovascular disease because it is the #1 cause of death in the Caribbean. And it so happens that it is also the #1 cause of death and illness in the BVI. So we were happy to take on that mandate, and we felt that bringing some experts here to tell you the whole story would benefit you. So we're going to provide you with information to, if you already are on that spectrum, how you can manage yourself, and if you're not, how you can do the risk assessment to decrease the chances of you ending up with cardiovascular disease. We at BVIHSA, we know the challenges firsthand of providing services for persons who may be living with cardiovascular disease. We know that it is a growing problem. And although we don't have exact statistics, NHI statistics in 2020 suggested that there were some 10,000 persons in the BVI living with hypertension. And at the HSA, we know that 10 to 15% of our admissions to hospital are related to cardiovascular disease. And so it is something that we want the community to become more aware of, and we want to provide you with the information that you have, that you can have to make the change that you may need to make. So I want to welcome our panel today. We're very honored to have them here with us. We have some persons who are visiting from overseas, and we have those who are here with us locally, and you will hear from all of them today. So sit back, relax. It's a panel discussion for a good reason. You get to ask any question you want to ask. No question is off the table. All right, so we're looking forward to that. And if you don't ask the questions I expect you to ask, I'm going to ask them myself because I have some. So welcome and have a good day.
Thank you, President June. Okay, excellent. I have been asked, so we're going to actually cut right now. And we're going to fix our studio audience. So if we can have some of you that are in the back coming a bit more up front, because this doesn't make for good TV. Okay, if we can just have some of you come into the front. We promise we will not pick on you unless you ask. We thank you. We appreciate you. we did a little better. We did a little better. All right, so we'll start back in 5, 4, 3, 2. And once again, welcome back. We are here in recognition of Cardiovascular Awareness Month. And before I allow the panelists to introduce themselves, we do have a game changer who is going to speak to us this morning, the minister himself. And so when he comes to the podium, because whatever is said in the room today, we are going to task him. We are going to make sure that the clarion call is heard and the assistance needed. We know he is ready, willing, capable, and able to provide all that is needed and required. So when he comes to the mic, he's going to come up here like Mike Tyson, right? Because we are here fighting for each and every one of us in this community. So please welcome the Minister of Health and Social Development, the Honorable Vincent Wheatley.
I swear I didn't pay her. But good morning, all. It's so good to see all of you here today. And it's so very important symposium. Like I think Dr. Samuel said, you're in for a treat today. And I hope you can stay as long as you can. It goes until about 12 o'clock, I believe. I am going to stay as long as I can myself. But I'll go through my brief remarks. I'll be very, very brief. So again, good morning to all of you. Good to have you here. I am Vincent Wheatley, Minister for Health and Social Development. It is my distinct pleasure to welcome you to this very important Cardiovascular Symposium held in collaboration with the Rotary family of the BVI. And you see all the clubs are right here behind me. I want to commend all the presidents for taking on the mandate of your district governor, Mr. Dr. William Eichen, District Governor 7020. Thank you for your continued commitment to service and community well-being. I also welcome our healthcare professionals, our partners in health, and of course, you, the audience. I also speak as a past president of Rotary Club of Rotown. Cardiovascular disease remains one of the leading causes of illness and mortality worldwide, and the Virgin Islands is no exception. Today's symposium provides a vital platform to bring together healthcare providers, policymakers, community leaders, patients, and stakeholders to engage in meaningful dialogue, share best practices, and explore practical strategies to improve cardiovascular health and wellness across our territory. This partnership reflects the power of collaboration in advancing public health. When a government, service organizations like Rotary, healthcare professionals, and wider community work together, we can strengthen prevention, improve early detection, and promote a healthier lifestyle for all our residents. Therefore, I encourage all of you to be mindful of the early warning signs and to prioritize your annual health checkups. I want to commend the Rotary family of the BVI for their leadership and partnership. And I thank all those who have worked tirelessly in organizing this timely and impactful event. A special thank you to the BVI Health Services Authority for the important role that they have played as well. I encourage everyone to take full advantage of today's discussions, to share openly, and to leave here inspired to take action in your prospective domains. I wish you a productive and engaging panel discussion and symposium. Before I take my seat again, I want to sincerely commend the Rotary clubs. They have been excellent partners in healthcare from your current project, defibrillators at various islands, including the sister islands, and for your continued healthcare support. I think what you cover of Tortola, they're sponsoring screenings, various screenings here in the BVI. Apart from the cardiovascular, we also have the other cancers that are very prevalent, cancers like breast cancer, cervical cancer in women, colon cancer and prostate cancer in men. And with early detection, it does save lives. Rotary has been a really good partner in partnering with HSA, making sure people get regular screening and that the burden of payment is removed in most cases. What we've seen since we've brought in NHI is persons are doing more screening now. Some people think the cases of cancer are up, but I don't think they're up. I think we're just getting more information. As persons are being screened more, we're identifying cancers more. Again, early detection is the key to getting treatment as early as possible. I also want to sincerely thank all the presidents for being here today and putting on the symposium. And I had to leave other activities to come here. It was actually my office this morning. Then I remembered I have to get on my ferry and come to the symposium. But I thought it important enough that if you're going to do this on a Saturday, I should be here to lend my support. Again, thank you for being here, and thank all of you for the work you have done, Rotary Club family of the BVI. Thank you.
Excellent. And I was advised by President June, since you did indicate that you're a past president, that the forward test also indicates that we are going to really hold your feet to the fire after certain decisions and takeaways today. I want to recognize, because this is a full-bodied event, and you coming here today is a testament to the fact that you want to start looking at your own wellness. And so I want you to give yourselves a round of applause. I also want you to keep that applause going, because we have significant representation here today, aside from the panelists that we will get to shortly. So as you are aware, the BVI Health Service Authority, as well as the BVI Rotary family, are the ones that engaged to make sure that we were able to bring this for you. We also have the Mutual of Omaha Insurance. Oh, beautiful. Okay, in orange. I promise you that's not BVI electricity. Nothing getting cut today. We also have Sapphire Health, BVI Health Services Authority, our community health team, who have been doing a tremendous job. I am intimately aware of how much they really put in. Talk about really working from the heart. That's that team. And so, of course, they are also offering the flu vaccine, I was advised. So should any of you, as you know, we are in flu season, and this has been a very wet month. So this may be a good opportunity, because I got wet 3 times last week in trust. The cough was there. This may be an excellent time for you to make your way over on the right side and see what sort of additional care you can receive, because there are other things going on as well as that at that table. In addition to that, at this time, I'm going to allow the panelists to introduce themselves, because this is the heart and meat of the matter today. And we are very excited to start to break down or should I say uncover some of the layers. I'm saying, Dr. Wheatley, I'm watching you and I'm smiling. So I'm just going to ask for the mic to get passed. We're going to share, and I'm also going to ask for the podium to be removed because I feel this is a barrier. And I really want us to sort of get down into, yeah, this is why the podium will be removed. So I'm also going to help. So Dr. Wheatley, you can start.
Good morning. Okay. I'm Dr. Amber Wheatley. I'm one of the family physicians at Nurse Iris O'Neill Clinic in Virgin Gorda. And I have a special interest in rural and remote health. I'm also a yoga and Pilates instructor. So we're going to get a little bit of movement going today when I do my session. And I'm pleased to be here.
Welcome. So when you start to get irritated with your children, she's going to teach you the techniques to breathe deeply, right? And de-stress.
Good morning, everyone. My name is Antonia Matthew. I am the community dietitian working with BVI HSA. I'm also a lactation consultant. And this morning, I'm going to be sharing about nutrition and how we can use that to reduce the incidences of cardiovascular diseases, and also if you have a cardiovascular disease, to manage that well. So I'm going to be the lady talking all about food this morning, basically. I'm very, very excited to share with you this morning.
Good morning. My name is Doris Reimer. I'm a cardiovascular patient.
Good morning, everyone. My name is Roger Miller. I'm a cardiovascular and thoracic surgeon, which means that I do surgery on the heart, the blood vessels that lead to the heart, from the heart, on the heart itself, and also anything to do with the chest and the lung. And today I have 2 of my patients with me, and they're here to share their experience. Thank you.
Good morning. My name is Lenia Smith, and I'm also a recovery cardiovascular patient.
Morning, everyone. My name is Handel Emery. I'm a cardiologist, and it's a pleasure to be here. Let me stand. I'm quite short, so perhaps an easier way to be seen. Okay, so yes, I am a cardiologist. It's a pleasure to be here. Cardiology and cardiovascular disease is something I'm extremely passionate about. As has been said many times so far this morning, cardiovascular disease remains the #1 cause of death globally, and this has been so for quite some time. We can explore some of the reasons why this is so. There are a number of extremely good reasons which explain why cardiovascular disease has become such a prominent feature of our daily and weekly and monthly existence. And perhaps we can begin to tackle some of those and address some of those issues. So again, it's my pleasure to be here, and I look forward to an entertaining and excellent session. Thank you.
Well, good morning. And first of all, it's such an honor to be here with you this morning. My name is Don DePetty. I'm a physician, a general internist, a primary care physician. I did my residency training in the United States in internal medicine, and then I didn't know what to do thereafter, and I couldn't decide on an individual subspecialty. So some wonderful senior faculty members rescued me. And they had started a new hypertension program in Boston. It was the first of its kind, where specialists came together as a team to tackle and do research and clinical care in a different entity, and that was hypertension. And they asked me to join them and be their fellow, and that's what I did. Since then, I've dedicated my entire career to not only the research on hypertension and vascular disease, and also the target organs of hypertension, the kidney, the brain, and the heart, as we've already heard, among others such as eye and vessels. It's such an honor. I've spent my entire career sort of on the faculty level. I rose up administratively to be dean of our university at the University of South Carolina School of Medicine. But something happened about 10 or 15 years ago that was absolutely out of the blue. I got a call. I got a call from our Centers for Disease Control and the Pan American Health Organization. And they said that they wanted to get a group together and start thinking about how could we tackle cardiovascular disease, but starting with hypertension, the major risk factor for cardiovascular disease, not in the United States, not in Canada, not in Australia or the UK, but the world, globally. And let's start with the PAHO district, which is obviously Latin America and the Caribbean. They invited me to a meeting in Miami in 2013. We had no idea. I didn't even know why I was there, because I did not do population-based medicine. I did not do global medicine. I did some mice in our lab and some drug medicines that you're taking now. But it's been a wonderful journey in this stage of my career, and I've stayed and played a leadership role in the HEARTS program. And there it is right over there. You can see the hypertension clinical pathway that came out of our work. And again, I'm honored to be with you and to talk a little bit about the HEARTS program, but more importantly, how can we get to the individual when we have such a population crisis on our hands and a global pandemic, if you will, of non-communicable diseases, including, of course, number one, cardiovascular disease. Thank you for having me today. I hope I can add value.
Excellent. And we did promise you that this would be a very well-rounded symposium. And the name that does not need introduction, the Back to Life group. So it's not just Jesus rose from the dead, apparently. Let's see if this takes 3 days.
Good morning. My name is Jo Lawrence. I'm a CEO of a company in the UK called Back to Life. Yes, we did name it after the song by Soul to Soul back in the 90s. We basically provide resuscitation training to hospitals, community and private organizations all over the UK. And back in 24, we had a conversation with the BVI who wanted to align to the UK Resuscitation Council guidelines. And as a company that was doing training throughout the UK, we had conversations and we were found to be the right partner to work with the BVI. Since then, I have been bringing a group of volunteers over to the BVI to work within the hospitals and to upskill and align to the UK in our guidelines, which is not dissimilar to the US at all. We're all on the same page. But essentially what we're looking to do is to try and prevent cardiac arrests in the hospital. So a lot of our work is about helping to educate within the hospital doctors and nurses about the prevention of cardiac arrest. But we're now looking and having discussions about how we can help the community to save lives, because the sudden cardiac arrests don't happen in the hospital, they happen out in the community. So I'm delighted to be here, and Helen, who is my colleague, who's worked with me since we started and actually chose the name for the company, so she's done very well there. We're going to give you a demonstration on perhaps how you might help people who collapse in the community a bit later on. So we are very privileged and glad to be here. We've now been working with you for 2 years and we have another 3 years, and then who knows where we'll go. But we've been starting to go out to your islands now, and we're hoping to help impact on your community programs. Thank you.
And the last person I'm going to pass the mic to is Lisa Adamson, the drill sergeant.
Hi, good morning, everybody. How is everyone this morning? We're good? We're well? Marvelous. Good. My name is Lisa Adamson. Thank you, Zoe. Thank you, President Violet, who we go way back. One of my first clients. I'm a qualified personal trainer, fitness coach, fitness professional. I have been doing this for 34 years, mostly. Yes, most of my life, over half my life, and a little bit more. And I've lived in the Virgin Islands also for 34 years. This is my home. I'm qualified as a personal trainer. I'm qualified as a corrective exercise expert and coach. I'm qualified in Zumba. Anybody? Yes. I'm qualified in aerobics and spin, and also qualified Pilates instructor as well. So I have my fingers in lots and lots of different pies. Fitness is one of my great passions. My first passion is cycling. As my great friend will know that as well. Done lots of cycling over the years just to keep health and well-being. And thank you for having me. And I'm really looking forward to today. I always say knowledge is power. and we're never too old to keep learning. And for me, I think this is fantastic. So thank you for inviting me. I'm looking forward to it. And I'm looking forward to hearing everybody on the panel as well and learning a lot more specifically, especially for what I do for a living. Thank you. Look forward to hearing from you.
So there you have it. So we'll look at risk prevention. That's what we've been hearing, what to do in the event of, but also how to avoid. And so at this time, I'm going to go straight to the panelists. All right. And feel free to jump in. And I'm also here to facilitate the mic. So we're not going to wait until they're finished for you to be able to ask a question. A lot of you already came in with questions. You need the answers. We're going to provide those for you. Okay? So I'll just take a little rest. All right, feel when you're ready, okay? So, all right, beautiful. And I'm not going to put this to anyone in particular, so please feel free, whoever wants to take the mic. So we've already understood that cardiovascular disease is the leading cause of death in the Caribbean. Now, what makes this such a critical issue for the BVI specifically? We heard about some numbers in terms of NHI, but why the BVI? Why are we focusing on that, even though it's Cardiovascular Awareness Month?
So I think I'll start, not to completely answer the question, but just to give a little bit more perspective of where we are in the BVI. Dr. Samuel and her team did an audit, recent audit actually, between 2022 and 2025. And as she said earlier, and that is at BVI HSA. And our admissions is about 15% of all admissions, which means that between one to two patients out of every 10 patients is admitted for a cardiovascular related disease, right? And this audit, because when I saw it, there were all these graphs and all of that, but it didn't take into account every single cardiovascular disease that was there, right? In addition to that, most of the admissions were between 65 and 79 years old. So that's really, really good information, which means that as you get older, the chances are higher that you're going to be admitted to us with a cardiovascular disease. And then the younger patients between 51 to 64, they were like second, right? So the older patients were more likely to be admitted. This is scientific information that I'm giving now, all right? Strangely enough, I found this part very surprising that male to female ratio was approximately the same. Normally you'll find that, men, we don't, take care of ourselves very well, right? But the values that we have show that it's, between 1 to 1, 50% each, right? And then mostly patients will spend about 10 days in hospital, which is, quite a long time. So that will incur costs to patients, stress to their families, that kind of thing. But strokes came in at number 1. Heart failure, heart attacks, those were, the top 3 that really affected patients who came in for admission. I want to emphasize the mortality. No, this, it's not a very nice topic to talk about, but clearly these things will cause death, right? And during the study period, that's over 3 years, there were about 204 deaths related to cardiovascular disease, right? Which is a lot for the BVI, right? Or at least what we recorded in the BVI HSA. And this accounted for almost 50% of the death. Oh, sorry, Minister.
Is that for the whole Caribbean?
No. I'm talking about the data from BVI HSA. Yes. Right. Between 2022 and 2025. Right. And that is accounting for 50% of the death recorded. So this is not us spitting out numbers. This is not us saying, oh, yeah, the world is like that. These are actual data that we've collected from BVI HSA. So I want to just put that in context to set the tone for the rest of the conversation.
Wow. So it's also known as a silent killer. And as you rightfully stated when you quoted some of the numbers, we recognize that hypertension, diabetes, obesity, what are some of the other factors that attribute to a cardiovascular?
So I'm going to give the rest of the panelists the opportunity to speak as well. But I just want to, I know we're in February and it's all about the heart and it's heart month. But remember, we have to think about cardiovascular. If you break it down, it says cardiovascular, right? Which means certainly the heart is at the core of things, right? But the vessels, right? Any plumbers in the audience or know anything about plumbing? I know Dr. Penn definitely does, and probably the minister as well. But basic plumbing, we live in the BVAP, most of us would have cisterns, right? So I think about the heart and the circulatory system, just like plumbing, right? You have the water source, right? There's a pipe that goes to the pump, right? You guys can correct me if I'm wrong. The pump would send it through a bigger pipe first, then it gets distributed to the rest, right? To your faucet, to the toilet, to your kitchen sink, right? Am I correct? Okay, good. Exactly. So it's the same thing with the body circulation, right? So that is why they call the heart the pump. Just like in your house, there is a pump at the center of it, right? And the heart gets blood from the rest of the body. Then it pumps it towards the lung and the rest of the body. All right. So so you can look at the circulatory system in a similar way as the setup of your house. And if there's a problem with any one of those pipes, if it's leaking, if it's blocked, right, then it can cause an issue in terms of getting water to where you want it to go, right? So we think about these places, so it can affect your brain, right? Your kidneys, right? These are some of the places, and also what we call peripheral arterial disease. Patients with pain in their legs, they're getting amputation. These are all a part of this general cardiovascular disease that we think about, stroke as well. And of course, the big one is the heart, right? So heart attack, coronary artery disease. So it's not just things affecting the heart itself, but other end organs, as Professor said earlier, all right? Repeat your question, Zoe.
So I was asking, you have all these different ailments that
Yes.
lend itself. You have hypertension, diabetes, obesity. I was asking if you could sort of break down for us what are some of the commonalities that allow for us to get to a cardiovascular situation.
Okay, so I'm gonna hand this over to either Dr. Emery or Prof.
Sure, let me take a stab at that. All right, so I think the question is a very good one. When we look at the risk factors for cardiovascular disease, which was the original question you'd asked before your second question, but we divide those into what are called modifiable and non-modifiable risk factors. And this is an important distinction because it gives us an insight into the aspects or into the risk factors which we can actually intervene on with the goal of reducing or perhaps even preventing the risk of progressing to developing cardiovascular disease. So what are the modifiable risk factors? They include hypertension, which was alluded to earlier. They include diabetes. They include cigarette smoking. They include being overweight or obese. They include dyslipidemia, which means a very high cholesterol level. Okay, and there are some other subtle ones which I won't necessarily get into for this audience because they're a bit more nuanced and perhaps a bit more suited to a more scientific audience. So we can just leave it at that for the modifiable risk factors. But then we also speak or make reference to the non-modifiable risk factors as well. And these include, get ready for these, age. Okay, so as we get older, we accumulate more and more fat and cholesterol within our blood vessels or vascular tree, which does put us at risk for developing cardiovascular disease down the road. So age is a big non-modifiable risk factor. Number two, gender. Okay, so males tend to be more susceptible to developing cardiovascular disease for a number of reasons, which we could explore down the road. Okay, number 3, ethnicity. Okay, so there are some ethnic groups which are also at greater risk of developing cardiovascular disease. And we generally make reference to persons of Southeast Asian ancestry as being a very high risk group. So obviously we can't change somebody's gender. Well, let's not go there. Right. Yes. We can't change someone's age, okay, and we can't change someone's ethnicity. So it means that what we can and should do, and this is one of the foci of Heart Month, is to maintain a laser focus on the modifiable risk factors. How can we control our hypertension or our blood pressures? How can we control our blood sugars for a diabetic? How can we reduce our serum cholesterol? How can we maintain a healthy weight? Okay. How can we embrace lifestyles which ultimately reduce the risk of progressing to cardiovascular disease? Okay, I'll end my comments there.
Well, actually, no. I want you to jump back in because you're doing so well. So at what age should individuals really start paying attention to their heart health? And I actually should just say health, period. So at what age? Because ordinarily, for instance, when you hear about potential cancer patients, they would tell you you need to start checking at certain times. Is there a designated time? We mentioned age earlier when persons should be looking into.
Okay, another very good question. All right, so, and the answer is nuanced. Why do I say that? I say that because what you're referring to is screening. That's what you're alluding to. And the age that we start screening patients for cardiovascular disease or indeed for the risk factors which predispose depend in large measure on the patient. Why do I say that? Let us say that you are Southeast Asian, right? As I alluded to earlier. Let us say that you're a smoker. Let us say that you have a family history of diabetes or hypertension or cardiovascular disease, okay? So those high-risk patients or patients who are at a greater risk than average of developing cardiovascular disease, we would start screening them at an earlier age or start paying attention to them at an earlier age. But in general, my general guidance would be at about age 20, it's reasonable to have your blood pressures as well as certainly your blood sugars as well as your cholesterol done about every 3 to 5 years, starting at about age 20. Certainly by the time you get to age 50, those should be done at least annually. Okay, so you should be having annual blood work done, should be having your cholesterol done annually, and you should be having your blood pressures done at least once a year. Okay, and certainly if you have risk factors, right, as I alluded to earlier, then we need to start earlier and be even more aggressive in terms of the screening frequency.
Okay, beautiful. You were going to add to that? So basically what you're saying is at 20, make sure, just like you take your vehicle to the mechanic, before there is an issue, we want to make sure you check yourselves before the check engine light come on. Dr.
Yes, I just want to add to what Dr. Emery said. So by telling a story, I think I said the story on a radio program a couple nights ago. And when he said, oh, you start at about 20, right? So when I was in medical school, I'll go really quickly with this story. When I was in medical school, we had to do pathology and do autopsies, right? So there was a gentleman who came with a motor vehicle accident, died from that. I think he was around 19, thereabout, pretty close to the 20 that Dr. Emery suggested. And we're doing the autopsy. Part of that, you needed to look inside the blood vessels, the big one that leads from the heart, the aorta, right? So we opened up the aorta, and to my surprise, there was actually disease inside this 19-year-old gentleman's arteries already. I was a bit surprised, right? Clearly, Professor, he has seen this before. It wasn't an obese patient, looked, quite thin, healthy. So, but I was surprised that at that age, there were already changes inside the arteries. So I concur with what Handel is saying in terms of really and truly, these things start earlier than we think. They just get worse as we get older. Okay, bro.
Let me support your the one patient that you saw in medical school. I was stunned when I was in medical school. One of my professors taught me that there was a study that I've never heard of, and many people have not heard of. War veterans from the Korean War. They were US veterans that obviously died in the Korean War. The average age was 18 and a half years of age. They did autopsies on a subset of these unfortunate young men. And to the absolute support of what was just said with the single patient, we saw in hundreds of these young, unfortunate war veterans, severe atherosclerosis in these individuals, as starting at least at the median age of 18 in these individuals, 18 and a half years old. That was stunning to us. And it was turned the pyramid upside down. And that was the first warning sign. And here we are now, 50 years later, still trying to discuss it and get individuals to understand that this starts in children. And I'm going to be even more controversial. Please spare me for this. It starts in utero. We now know that the maternal environment that the baby is exposed to makes also a huge difference. A mom that's pregnant, of course, and having a baby, or at least in utero, if she comes into that pregnancy with hypertension, even mild hypertension, not only is that she at dramatic risk for cardiovascular disease and cerebral disease during the pregnancy, but if you follow those young women years later, they have a 3 to 4-fold increase in cardiovascular disease amongst themselves. And the earliest warning sign was pregnancy, either at an early age becoming pregnant or developing hypertension, gestational hypertension during pregnancy. That would be bad enough alone, but we've now followed the babies. And those children that were exposed to that environment, the hypertensive environment during pregnancy, during gestation, also are at high significant risk of cardiovascular disease starting in childhood, in single digits, 5 years old, 8 years old, 10 years old. So it's an interesting question. And what we're doing is the clock is just being turned back to the earliest time that we can. So it's a lifelong, and it starts actually from the very, very beginning. So those individuals now we are trying to follow, screen more closely the mom and the child during their early adult lives, and we're finding significant lipid disorders. We're finding significant vascular disorders. The blood vessels dilate and constrict on their own. Dilation is very important under stress, exercise, etc. We now know that these children cannot dilate those blood vessels to get the blood flow they need to their muscles, etc. That's called endothelial dysfunction. It's a fancy word, but it doesn't matter. It's a plumbing question. Thank you very much for at least letting me explore bringing pregnancy and young women into this crisis as you will.
Going on to that same question that Zoe asked in regards to what age specific of screening, and you said more or less about age 20 specifically, and definitely from birth. Both I agree with. So a couple of factors here. In the past several years, there have been several professional footballers that have literally collapsed on the pitch during a football match. And, at first, the first one, no one knew what was going on. And then another one, and there were ages 19, 24, no older than that. And then there was obviously research done on this. So one of the things that we do here that I do know is that the BVI Football Association here, anytime our young kids are going off island to play matches overseas, they all have to go in to the local doctor here to get checked. And they have to answer questions and their heart is checked. And some of these kids are age 7, they're age 9, they're 12, they're 14 years old. So already, we are here doing that already, specifically from a young age. It's just now making the rest of the world do the same thing. And specifically with any sports, as well in worldwide, no matter what sport it is. If that child is starting a sport and starts to compete more competitively, then that should be then taken up with their, I don't know, cardiologist, their doctor, whoever, their general practitioner, of everything. Okay, well, you know, he or she is going to be doing this. Let's go and do an overall health. So that can start again at age 9. Yes. I know that might not be the many factors, but would there be factors from that age specific if they are, you know, going to be doing more professional or, you know, a more intense sport?
I'll just take a quick stab and then I'll hand over the microphone as well. So you're alluding to a very important issue, which is sudden cardiac arrest in athletes, which is a very important and very topical issue. It's something which has been in the news for some time now. You probably recall footballer Eriksson, I believe, Scandinavian footballer who collapsed on the pitch. And there have been several other high-profile instances. So these have helped to really catapult that issue into the public domain in a lot of ways, and justifiably so. So there are specific guidelines which have been published now by the American College of Cardiology and the American Heart Association, as well as the European counterparts, which speak specifically to that issue. Now, those guidelines are not don't necessarily match, specifically in terms of how the screening should be done. That is an area of some disagreement, I would say, between the two guideline writing committee bodies. One of the issues, though, in principle, it's a very good idea. One of the issues is cost. Cost is a big issue. So, for example, who do you screen and how elaborately do you screen them? Do you screen hundreds of thousands of athletes in order to identify one or two who may have an issue? Is that an economically viable approach? All right. So these are some of the nuances. There's also the issue, well, there's also the nuance, let me put it that way, that screening is not always diagnostic. So you can screen someone who has disease, but your screening methodology, because of something called sensitivity, it is not able to identify the disease. So it is possible to screen a patient for a disease, your screening tests come back normal, but the patient still has a disease. So that compounds things. There's also the issue of downstream costs. So for example, you screen someone, you identify maybe T-wave, an abnormality on the ECG, let's put it that way. How far down that rabbit hole do you go? Right? So there are all of these nuances with screening which complicate the issue. And for that reason, my bias is, my view is that we should proceed along the lines of the American guidelines, which is that the screening primarily focuses on history and physical examination, and then persons who have been identified as having abnormalities on history or physical examination go on to have further testing, whether it is in the form of an echocardiogram or a stress test or something else.
We'll be moving to the nutritionists and Dr. Wheatley shortly. But before we get to that, you were able to compound on the fact that there are a number of factors, age, ethnicity, and now you hit us with a curveball, which basically says some of us, while in the womb, would already probably be one of those individuals that may suffer a cardiovascular crisis. So how much does lifestyle actually make a change? So based on all the factors that we're hearing now, because we want to hear from the nutritionist, we want to understand what are some of the things we eat for health, exercise, but how much of an impact does lifestyle change now make for that?
Hello. So now lifestyle change is one of the biggest factors because as we've talked about, you have your modifiable and your non-modifiable risk factors. The modifiable risk factors, which is essentially your lifestyle, is the only thing that you have control over. And we have thankfully also had some patients who we've identified quite early who have, they're just starting to get high blood pressure. They haven't quite got to the stage where it's out of control. And with diet and lifestyle changes, they're able to come off medication, get back on normal blood pressure, and have their life back in a sense. It's also one of the hardest things to do, right? Because lifestyle encompasses a lot of things. So we talked about risk factors like smoking and drinking alcohol. But one of the things I always tell my patients is that stress kills. And they all laugh at me, but it does. Sleep deprivation, having a high stress environment, having, a lot of things on your mind all the time can push up your pressure. And even with the blood pressure medication, it wouldn't come down. I've had patients who, through a grief reaction have ended up in the ER, right? And then, somebody gives them a blanket and a cup of tea and all of a sudden the pressure is fine. But it's something to take seriously, because once that pressure is elevated, you can have a stroke, you can have a heart attack. It only needs to happen once.
Well, we are in the love month, and for some people it may not go as well as we would like.
Yes.
And I did have a conversation with Dr. Aiken last night, and I asked him the question, right? Can you die from a broken heart?
You can.
And so, I do want to put things in perspective, because sometimes it's the things that we think it isn't, it actually is. So I wanted to bring that here for some of you. Next week, in case it does not work out, we're going to give you some training in terms of how do we mediate. All right, so Dr. Wheatley.
No, absolutely. So your mental health has an impact on your physical health and vice versa. And if you even want to add a spiritual element to it as well, right? We all have hopes and desires of how our life will come out, and it doesn't always match reality. So we always try and encourage people to take a multidisciplinary approach with managing their blood pressure. Okay, look at what you're eating. Look at your activity level. Are you sitting most of the day? Look at the habits that you have around your life. Are you eating unhealthy food because you're accustomed to going to a place that doesn't have the food you're supposed to be eating, or getting the food from somebody who doesn't cook it the way they're supposed to cook it, right? And you have to look at all of these things together. Now, when it comes to your relationships, obviously, the people closest to you can also be the one that hurt you the most. It can be one of the biggest source of stresses. So we always encourage people to use stress management techniques, conflict resolution techniques, to contact somebody to help if you are struggling. We have the mental health services available in the community to, use your spiritual advisor if you need to. Take a break and give yourself space, rather than trying to dig into the issue and causing both of you stress.
Well, let me ask you a question, and I will get to the fact that being that we are in the Caribbean, we have some big backs. We are people that like our Caribbean food. And how do you marry between the culture and health? How do you make that transition? So I'll let you, and then I'll come back to you, Dr. Wheatley, if you don't mind.
Absolutely. So definitely here in the Caribbean, we have some diet practices, some eating practices that don't always lend to the best of health for us, especially when it comes to cardiovascular diseases. And I am not at all going to sit here and say that we have to take away all of our cultural foods for the sake of, pursuing a healthy heart. We want everybody to have a healthy heart, but you also need to enjoy the food that you're eating. That's also part of having a healthy diet. And what we do is try to make some practical changes in order to facilitate that. So for example, where we might have a plate, and I'll just be frank because I absorb a lot of plates. Most of it is going to be that carb, right? No matter where you go. So you'll see a plate and it's rice and peas, macaroni pie, potato salad, coleslaw. All of that is on a plate. And then you either have your stewed chicken or some type of fried protein, steak, whatever, something that also on top of that has cream sauce added to it. And then when you look at the plate, you see just a little sugar pizza,
We feel judged.
Not at all to judge, but just a little bit of vegetables over there in the corner. And because the vegetable is on the plate, we think, yes.
Psychological warfare.
We've done it. And so one of the things I typically encourage people to do in just everyday planning while we're eating is to follow the plate approach. And so I brought my plate with me. So most of what you should be eating, see this big section right here? That is not the rice and peas. These are your vegetables, right? And so we want most of what you're eating to be vegetables. That's going to make sure that we have quite a bit of fiber on the plate and some other nutrients that we need. Fiber is one of those things that are really protective of the heart, of the digestive system, all of these other working factors. So we want to increase fiber a whole lot, and we can come back to that a little bit later. And then we go with your protein source, a lean protein source, right? And then we go with a whole grain as much as is possible. So that's an easy swap that people can make, not taking away the cultural foods from the diet, but let's portion it out in a way that makes sense and that is beneficial to our health.
Yeah, hi, thank you for that. Thanks. Sorry, me again. So one of the things in regards to going back to cultural food specifically, originally it was mostly root vegetables, right?
Yes.
You know, so my motto is when I'm with clients is if God made it, you can eat it, right? Which is mostly back to your root vegetables, etc. And you'll know this as well, specifically over the years with our supermarkets, bringing in other produce, predominantly from the US. And apologies to anyone from the US in regards to the diet up in the US, as you know, with obesity, etc. Yeah, because they want to make food cheap. Okay, so you know, high fructose corn syrup, which I call food for cancer. You know, so you know, I was in the supermarket the other day, and a lady was choosing between two different ones because of the price, not because of nutritional value. You know, and so that is a factor here in the whole of the West Indies, but also in the BVI, because we have to pay so much for all of our foods to be shipped in. You know, and now we have quite a few places, you know, obviously I'm going to say like Walmart, they sell a lot of local produce, which is from our farms. And we do have to do farm to table, you know. So again, it is like you're saying with the plate, etc., vegetables, and choosing those right foods. But it's also just, you know, when this lady said that to me, because it was over price difference, not over nutritional value. And again, that is something that we have in our society here. Yeah, I'm not wrong on that. It's because our food is expensive, because it is shipped in, and obviously with what goes up in the States, then that changes the price as well. You know, so you know, it's putting out there to everybody of making them realize that the more root vegetables, the more healthier options. Yes, it is more expensive, but for longevity, it helps you in the long run. But again, that is just like another matter, which you said before, on getting out there on that type of education as well. But my motto is if God made it, then eat it. And if you can't pronounce any ingredients as well, if you can't pronounce it, don't eat it. Okay? Don't get me going about Gatorade. But anyway, that's a whole different matter.
Thank you so much for sharing on that. I'm really glad you brought that up because food security is really a huge issue here in the territory. I get a lot of clients that say, well, Miss Matthew, yes, I want to eat XYZ, but I cannot afford it. Right. And that's just the reality that we have. And so one of the things that I encourage people to do is use what you do have available. Of course, we want to eat fresh. Fresh is best. If you grow it in your garden, if you can get the local produce, all of that, that is excellent. That is the preferred way. But also for some of the clients who just simply cannot afford that, they have other financial responsibilities. There's some small things that you can do. So for example, I know some people are not a huge fan of frozen vegetables, but the frozen vegetables are just as good. When you're cooking them, the way I see us traditionally cook it in the region is that we add water to it and kind of like boil them down, which gives that mushy texture. And people will say, no, I'm not eating the frozen vegetables because they have a mushy texture. But it just is the cooking method. So you put a little bit of olive oil or just a touch of water, you put it in a pan, let it steam down itself. You use your frozen vegetables. It's much more practical in the long run because the frozen vegetables, of course, will last you a longer period of time. We also have a small issue here in the territory. I wouldn't say it's a small issue. It's a huge issue where sometimes you buy produce and then 2 days later, is gone, right? So the frozen vegetables will last you a longer period of time. I am not saying not to eat your fresh vegetables, but in a pinch, you can use the frozen. There also, when it comes to protein, I talked about lean proteins. Beans are a good way to get a lot of good fiber as well. It's a good protein source. People don't always have the time to pressure their beans and all of those things. And so a lot of people go for the canned beans. And one of the things we can do there as well is to make sure we give those beans a nice rinse, get all of that liquid off of it, and then you can proceed with cooking with your beans, or you could look for the low sodium cans as well. And so we don't want to, again, say, no, don't eat this thing ever, and go into debt trying to get access to these foods. Just use what you have. What I tell them is swap, don't stop. All right, so swap what to a healthier option, and keep your diet nice and tight in that way. Yeah.
Okay, excellent. You wanted to add?
I was just going to, yeah. Can you hear me? I was just going to add something more specific. So we were up around 40,000 feet. Let's get down to ground level. And there's something new. We've known about it for a long, long time, but it's just been coming out more and more in terms of our guidelines, et cetera, regarding lifestyle modification, but specifically diet. We've talked for decades about sodium and salt, and absolutely not good, especially, and we've already mentioned ethnicity, but race. Obviously, in Afro descent, in Black individuals, sodium is actually much more dangerous for cardiovascular health than in European white individuals. It's bad for everybody, but it's just even more bad. However, we're flipping the switch a little bit on salt. We're not changing anything about recommendations for salt. Obviously, low sodium is absolutely the goal. However, we're also recognizing a new element that's extraordinarily important, and it's in the opposite direction, and that's potassium. We've known in animals for a long, long time that if you give high potassium diet to the animals and you don't even change the sodium content, you improve their blood pressure dramatically and their cardiovascular health. So they oppose each other. High salt is bad, but low potassium is bad. It's the ratio of those two now that we're recognizing is probably even more important than either alone. So the new, at least the United States, the ACC guidelines have been mentioned, now recommend potassium augmentation. Clearly diet first. And well, where's potassium? We can look it up, bananas, greens, etc. However, I come from a very Caribbean state, South Carolina. I had a visitor from Barbados visit me for a week from the university in Barbados. And by the time the end of the week was concerned, he said, Don, there's more Barbadians in South Carolina than I met in Barbados. And I said, yeah, we've had hundreds of years of happening, this wealth of ethnicity and race. So in our state, we have extraordinarily low potassium intake, and it's initially through the diet. And one thing that we found is our South Carolinians, particularly our Black South Carolinians, are cooking the right stuff. Fresh green vegetables, collards, lettuces, etc. But they boil it. And when you boil it in a pot, all the potassium, all that good potassium that's in there goes out into the water. So I would rather tell them drink the water and throw the vegetable away. But no, that's not going to work, right? They'll never come back and see me. So in any event, fry it in a pan with olive oil, etc. So the potassium now is becoming extraordinarily important, to the point that in the guidelines now it's recommended to consider taking the salt shaker, the sodium chloride shaker off the table, and adding a potassium chloride salt shaker, a salt substitute, because it's 100% potassium chloride, and even to increase dietary augmentation of potassium through that method. We'd rather do it through diet, etc. But we need all hands on deck. So now I would like to throw in the importance of potassium when you look for your foodstuffs, etc., and changing some of our patterns from boiling to frying. This is not my area of expertise, trust me. I am way now on very, very thin ice because I just came from ice up north. Thank you very much. Yes, please add. Where did I go wrong?
No. No, just to add two dimensions to that, really, which is that just to go back a bit in terms of the diet, because I recognize there are a lot of laypersons here. So one of the things which has been emphasized, and I think it is important as a take-home message, is that you really want to shift your diet. As has been said, I'm just reiterating: fruits, vegetables, whole grains, nuts, legumes, ground provisions, okay, as a base or basis of your diet. Reducing meat consumption, especially red meat consumption. If you do consume meat at all, the preferred options are really white meats like fish and chicken, largely because they have a lower cholesterol content, okay? The point has been made that when we speak about diet, we're not speaking only about portion sizes either and the composition, but also the mode of preparation, as was just excellently outlined. The only thing which I would add to that is that when we speak about frying, it's important to consider what we fry with. That's an important point as well. So the options are butter, in general, are butter, margarine, or vegetable oils. Let's look at butter. Very high cholesterol content, very high saturated fat content, not a good option to use as your regular product to fry whatever you're frying. Remember, we said you shouldn't be frying much anyway, but if you do choose to fry, please don't use butter regularly. What about margarine? Well, margarine is obviously made from hydrogenated vegetable oils, so there is no cholesterol, so that's excellent. However, there's a very high saturated fat content. Not a good idea. Saturated fat does show a strong correlation with the development of cardiovascular disease. So that takes us into the vegetable oils. However, all vegetable oils are not created equal. Okay, so what we use in terms of making a distinction between them is a saturated fat content. So vegetable oils, being plant-based, really don't have much by way of cholesterol. In fact, they have zero cholesterol, most of them. But what varies is the saturated fat content. Now, as Caribbean folk, you probably don't know this, Prof, but we love coconut oil. We love the flavor, the smell, all of that, right? But coconut oil has a very high saturated fat content. About 90% of the fat in coconut oil is actually saturated fat. So it should not be your oil of choice. Now, I'm not saying you shouldn't use it occasionally if you want to fry your dumplings or whatever, your Johnny cakes every now and then, but it certainly shouldn't be your oil of choice. So we do recommend when you do choose to fry, which you shouldn't, but if you do choose to fry, that you use healthier options such as canola oil, corn oil, and olive oil. Okay, the limitation obviously with olive oil is that it has a very low, what's called smoke point. So it tends to smoke at a fairly low temperature. So it doesn't lend itself to cooking at high temperatures. But in general, you want to use those options if you do choose to fry, which you shouldn't.
What about peanut oil?
Peanut oil is also not a bad option. It's not a bad option. Exactly, it is okay. It's not quite as good as the others in terms of the saturated fat and unsaturated fat balance.
Yeah, I'm definitely glad you brought up the point about the cooking methods. Definitely what you use to cook with matters. And thank you, Doc, for going into that. I know as Caribbean people, we love coconut oil. And I often tell people coconut oil is so excellent for the skin and for the hair and for the nails and all of those things, but we don't want to ingest it too often. And when it comes to cooking methods, just to add the recommended cooking methods, because we said don't fry, but what do we do then, right? So we want to bake more, grill more, broil. Those dry cooking methods are not a little bit, they're better for us. Steaming, those cooking methods are better. If you are going to stew, what are we using to stew? We just talked about the different oils. So we're not going to drown the pan in oil before we saute and all of those things. Also, air frying is on the market. And if you can afford an air fryer, you can air fry some of those foods that you still love. You still want your food to be a little crispy, you know? You can air fry as well. So those are the cooking methods that we would definitely recommend.
Okay, I'd just like to add to what she was saying. For me, on both sides of my family, they suffer from hypertension and diabetes. So at around age, maybe 60 plus, when I found out what was going on in my family, I decided to make a healthy life change because I didn't want to be taking all those medication and so on. I said, not me, not doing that at all. So guess what? I too started the power to change myself. I changed my whole diet. I stopped eating all all red meats and so on, vegetarian mostly. I do fish, which I love, grew up on fish. So yes, I do. Is it this? Take this off? Okay. Grew up on fish and so on, and I'll eat like, turkey and so on. And I started walking. I did as much as I possibly could to keep myself going and stay healthy. And as I got a little older, and I did that for like 20 something years, and I was so surprised that I'm in the situation I found myself in because I really changed my lifestyle. I thought of myself as a very happy person. Don't let things get to me, basically. So why did I end up there? But any which way, I just want to say, for those of you, like say in the bracket of age 17, because that's when my whole thing, my experience started. Ended up doing the double bypass on May the 2nd of 2022. And those of you in the age 70, don't get worried. They got a lot of new techniques now to be able to help you. I'm looking at a lot of you and I know you're near there. So, but let's just keep hope alive. They're here to help us along and listen to your body. When you feel a certain way, don't go, bite his gas, or you will go and say, Mary Jane tell me the other day she had this pain here, but mine ain't there. So it can't be nothing like that I'm experiencing. Know your body well, and don't be afraid to go to doctors. That's what they're there for. I know mine must have been tired seeing me, but it's okay. If I don't feel well,
that's healthier to the plate. And I find that that helps people to make changes a bit more. Let's set more realistic changes for you while you're making those lifestyle alterations, things that you know that you're going to do. If I come and tell you, don't eat no more Johnny cake, don't eat no more don't eat any of it, you're not going to do that, right? So let's see how we can alter, how we can adjust so we can fit. I'm not saying now here to go and eat Johnny cake every day and patty. I'm just saying, let's alter what we do.
Good morning. I'm a bit late, so I may stray a little bit. So water is good for us, but in terms of bottled water, for instance, like those on your table, whether they're distilled water, spring water, I see we have a big sign up, in one of our localities about drinking bottled water. What can you say about water in terms of should we drink distilled water, spring water? What do you think about our public water system opposed to cistern water? What is your take on that, especially with the bottled waters?
I don't have too many thoughts on bottled versus I know for the environment, we do want to consume less bottled water. My thing is that people don't drink enough water at all. And so I don't really get into it with them with the bottle versus are we getting it from the spring tap? I really do love BVI Springs water. I will say that. It is excellent. It is excellent. It is excellent. But because people don't generally drink enough water, I don't get into the tussle with them about what kind of water they're drinking. Once I get them up to where they need to be, then we can start talking about what kind of water, distilled spring, etc. But my preference is what I will say here. My preference is spring water.
Okay, thank you. I want to recognize that we do have our District 7020 District Governor, Bill Aiken, in the room. And I will be sharing a bit of information later for our medical professionals who will be at our dinner later this evening. Go right ahead, Dr. Wheatley.
Just two quick things I want to add. So going off of what Miss Matthew was saying about the taste, some people think water tastes like nothing, and some people could tell you exactly which brand of water with one sip. So like she was saying, as long as it's a clean water source and you're drinking enough of it, whatever suits your palate is fine. The other thing that I want to mention is sometimes, I don't know if you get it here, but in Virgin Gorda, sometimes our pallets of water are left out in the sun for quite a bit of time. That can cause the plastic to degrade, and we don't really want that. So it's more about how the water is stored before you drink it, which you don't necessarily have that much control over.
Okay, thank you so much for that. And we're also going to go to Ms. Linia, one of our survivors. We share with us a bit in terms of what are some of the warning signs that you may have recognized, if any, prior to diagnosis?
Well, I didn't really notice any warning signs until it happened. I was at a Women's League meeting on the Wednesday, came home and out of preparing some dinner for my kids. I got severe pains in my back. And normally, sometimes you do get gas pains, and it's either the front or the back. So I used to hear my grandmother them saying, when you have gas pains, you take a bit of brandy. So I took some of that, nothing happened. I had the kids make some hot tea for me, nothing happened. Then they got concerned and they called the ambulance. I was took to the hospital, still not know what's going on. I was heavily medicated, in and out of it. I was there for about 2 days, and I just hear we have to medvac her. I left here, that was the Wednesday, I left here the Friday. All now I still know nothing as what's happening to me. And we went through Puerto Rico. I know when we arrived Puerto Rico. I know when we reached to Fort Lauderdale at the airport. I know when I arrived at the hospital and I heard the doctor said, first thing in the morning, we have to operate. And that was it. I know nothing. And then maybe a couple of days when I did recover and start to come through, my brother was there with me and all. He is saying that when I wake up, I was just trying to pull every tube out and everything because I don't know anything of that sort. So then after maybe about a couple weeks, it had some nurses came to attend to me and they say they hear this sticking and they ask me if I have a pacemaker. I said, no, not to my knowledge. So they review my records and they said, okay, you have a valve replacement. Still did not know that I had a torn aorta or anything like that until I got back here. I did therapy and everything to get me back to walk and everything and make sure. And I was there for about a month. And then I came home. I didn't even know that with the valve replacement I had, there were different types. Because there's a pigskin that lasts for 10 years, and then a mechanical, which could last you until your lifespan. And that's the one I got. So with that, there are certain conditions. You cannot use too much things with vitamin K, which has put a toll on my diet because just basically everything, especially all the vegetables, some fruits and stuff, is loaded with vitamin K. So it has been a challenge for me in terms of figuring out what foods I can eat, how much of this or how much of that. But I must say, thanks for the help that I got. My kids, my doctors, Dr. Miller, Dr. Penn, because I use both of them, and Holy Cross Hospital. They were very, very instrumental. And the one thing that I always tell people that the one doctor that was there told me of 100 people that do the surgery that I did, basically only 10% survive. So I give every day I wake up, I say, thank you, Jesus.
Well, before you pass over the mic, sorry, go ahead.
Okay, that was in end of February 2022. So February this month's going to make actually 4 years.
And what are some of the lifestyle changes that you've now adopted? We've heard chronicling in her King James version, where she documents everything. What are some of the lifestyle changes that you have now adopted?
Well, I can't say that I have fully adopted because I lapse from time to time.
Talk the thing.
We are human. We are human. And I do baking and I do cooking as part of my retirement job. So sometimes it is a challenge. But I cut back on my salt. I cook most of my food. I don't eat out. And I try to exercise as often as I can. Trust God and pray. And that's it.
Are there any other questions from? Okay. Yes.
Just going back to water quickly, just a little anecdote. There's a lady in North Sung, she's making 103 years on April 16th of this year. I asked her one of her secrets to long life. She said she has never drank bottled water in her life. She only drinks boiled cistern water. When she travels, she boils a canister and she walks with them. Just food for thought.
Note to self. Okay. No, I did mention earlier that we do have DG Bill in the house, and I am profoundly excited to introduce him to our illustrious guests and the panelists today, some of you who already have some familiarity. In fact, the Rotary family in terms of District 7020 were challenged with coming up with different mediums by which we were able to assist in either creating an awareness for cardiovascular or by assisting by fighting. And so a number of the Rotary clubs, you would see the banners above, actually have donated quite a number of AED machines. In fact, I think 2 were donated today. One at the Elmer Stout High School and one at the YEP Center. But each club has committed at minimum to donate 2 AED, which is an automatic external defibrillator, to different institutions spanning from Tortola to Virgin Gorda to Anegada. And I do hope that we will be hearing that Joss Van Dyke has some love coming up very shortly. I don't know if the minister wants to make any statements after DG Bill. after DG Bill, I'm going to invite you to come to the mic, a urologist pushing cardiovascular.
Thank you, President Zoe. Good morning, fellow Rotarians. Good morning, guests. So it's a pleasure to be here this morning. I want to tell you a little bit of the story, how we came to be doing this project on cardiovascular disease. So I'm actually a urologist, a glorified plumber. And typically when you're coming in as district governor, and in our district, our district is comprised of 10 countries and 16 territories in the Northern Caribbean. So it's a big district, 90 clubs, 90 Rotary clubs, and 46 Rotaract clubs. And of course, we have Interact and Early Act clubs. So it's a big district, and I have to visit every single club in the district. But typically when the district governor is coming in, he or she will have a project that they want to do. Now, I'm sure most of you will know that prostate cancer is the #1 cause of cancer deaths in the Caribbean. And in fact, the Caribbean has the highest mortality in the world. Sub-Saharan Africa competes with us in terms of prostate cancer mortality. So naturally, I wanted to focus on prostate cancer. But then something happened. I witnessed two videos that captured one, a colleague while he was playing squash. He collapsed, and none of the persons he was playing squash with knew what to do when he collapsed. And unfortunately, that medical colleague of mine subsequently died. I also witnessed a video of a nurse coming off from duty at the Port Maria Hospital, and she went into a store in Port Maria. Port Maria is one of the towns on the northern coast of Jamaica. And while she was shopping, she too collapsed. And again, a similar thing happened. People just congregated around her. No one offered her CPR. No one knew what to do. And of course, she too succumbed. And then I did a little research, and of course, I recognized that although prostate cancer is the leading cause of cancer-related deaths, cardiovascular disease accounts for a much higher death rate overall than prostate cancer. And cardiovascular disease is no respecter of persons. It affects both genders. It affects persons of all ages, unlike prostate cancer. So I said, although I have a natural penchant for prostate cancer, I think if Rotary wants to make a much larger impact, obviously cardiovascular disease would be the thing we should focus on. So I've asked all 90 clubs in our district to tell the community about the risk factors for cardiovascular disease, recognizing that cognitive awareness of risk factors doesn't necessarily change behavior, but at the same time, it's important that everyone knows what are the risk factors for cardiovascular disease. I also ask the clubs to ensure that their members are trained in CPR, cardiopulmonary resuscitation, and where possible, to teach persons in the community CPR as well. And finally, and most importantly, I ask the clubs to put defibrillators in public spaces where large numbers of persons congregate. Unfortunately, in Jamaica, I also saw where a number of our student athletes, footballers, again, or police recruits have collapsed. And again, for lack of a person trained in CPR or a defibrillator, these persons succumb to their cardiac event. So I am proud to say, as district governor, the Rotary clubs of the British Virgin Islands have run with the project, and they have been, putting defibrillators in public spaces. They have been ensuring that their members are trained in CPR. and they've been spreading the word about the risk factors. And so it gives me great joy as district governor to be here witnessing that. Yeah. And this is not going to be just a one-year project. If we were to make a real impact in cardiovascular mortality, this is something we're going to continue after the year is over. So, you know, I want to commend the Rotary clubs of the British Virgin Islands for really running with this project and taking it on. So thank you very much for your attention.
Thank you. Just to highlight, for those of you that did come a bit late, some numbers were mentioned earlier. I think we mentioned over 200 persons mortality rate in the BVI alone over a 3-year span, 2022 to 2025. All right. So when you take into account what the dynamics really indicate, it does mean that we have to take a more aggressive stance in terms of mediating. And so I'm going to now come to Dr. Whitley, because earlier you had already started indicating certain things that we can do to help to alleviate. So I'll give you my mic.
So things that we can do to alleviate our risk of cardiovascular disease. So we talked about lifestyle, so cutting smoking, reducing alcohol consumption, which is always a sticking point in the Caribbean, looking at our diet. Okay. So alcohol is measured in units. A unit is like a shot, right? So it's supposed to be 14 units a week with some alcohol-free days. Right now, some glasses of wine already having 3.5 units. Right now, I will say that the unit limit came about because in the UK, the Food and Beverage Association pressured the doctors to come up with a safe limit of alcohol so that they could market it. And they said there is no safe limit of alcohol. And they said no, but if you really had to pick a number, and they were like, they're still, no, not really, but I guess, you know, and they twisted their arm, and that's how they came up with these units. So, but alcohol is a big risk factor. Alcohol is an individual risk factor for 5 different types of cancers. So,
well, interestingly enough, because we've heard, and gentlemen have been encouraged to drink a glass of red wine when the evening comes to sort of just, you know, de-stress, and that was considered sort of like a modicum to wellness.
well, here's the thing. You give people an inch and they take a mile, because you tell them drink a glass of red wine and they're drinking the bottle every night, right? No, there is some benefit to having red wine. There's some antioxidant benefit, but you can get it from other places, as Miss Matthews said. It doesn't have to be the red wine. It doesn't have to be the red wine. Okay. Well, one of the biggest things is also exercise, which everyone knows, but they don't necessarily do. So one of my first questions that I ask my patients is, hi, how are you? How's the exercise going? Because I would have told them to start exercising the last time we met. Walking is one of the most accessible ways that we exercise. I always try and advocate for people to swim because you actually burn more calories, and it's good to be out in the water if it's safe and so on. Cycling, which is very popular among men in the BVI. I don't know why the women are not getting into cycling as much. But cycling is good, yes. It's very good for your cardiovascular health, especially with the hills that we have. You can add a bit of resistance training into it. So your recommended amount of exercise is 150 minutes per week of moderate exercise. So your heart is going, but you should be able to talk at a comfortable conversational level. And you can split up that 150 minutes however you want. Alternatively, you could do 75 minutes of high intensity exercise, like your CrossFit, your HIIT, your boxing, that kind of thing, or running at quite a pace. Have I lost anyone? Okay, fine.
What about those of us who are a little more sluggish?
So, what is moderate for one person might be high intensity for another person, right? So I usually recommend people when they're starting to get into exercise to use their heart rate as a guide. If you have one of these fancy smart watches or these devices that measure your heart rate, if your heart rate is going between 110 and 130 and you're walking up a flight of stairs, maybe you're a little bit deconditioned, but at least you know, okay, I can do a couple rounds on the stairs for a couple minutes, a few days a week, and I know that I'm getting my cardiovascular exercise in. That is what we call moderate, right? So your sluggish is not an excuse. Frequently, what I have with my patients is I will ask them about the exercise and they'll tell me they're stretching. Stretching does not count, okay? Stretching is your warm-up, exactly. It's your warm-up or your cool-down, but if that heart rate doesn't get up, you are not conditioning your body the way we need to do. So having said all that, I would like us to do a little group activity. We're gonna get our heart rates going. Now, normally I teach this is not in the chair, but I think that we are all able-bodied, so we're gonna stand up if that's okay.
Can we do both?
You can, yes. Exactly, yes.
So I'll do the sitting one.
So if you're willing and able, we're gonna stand. And don't worry about knocking your neighbor. We're all friends here. So I want you to imagine that you've just woken up, you've just gotten out of bed. So the first thing we're going to do is a nice big stretch. Reach the arms up, maybe gives ourselves a little wiggle side to side. Maybe we're gonna twist it around. And then all of us carry stress in our shoulders. We're gonna relax the shoulders, that's it, roll them back. You know, maybe give the head a little side to side. You know, just loosening things up. Now, we are Caribbean people and all people with rhythm, right? So we're gonna give our hips a nice little carnival wine, warming up your core, your abs, and your lower back. Everybody complaining about stiff back. You just need to do this in the morning and then change the direction. Exactly, hula hoop. Now we're gonna get our blood going. So we're gonna reach our hands up and then lift the left knee. Hands up, right knee. Hands up, left knee. Hands up, right knee. Okay, now we got some music in the background. So guess what? You find your rhythm and let's go to the beat of the music. You don't have to go to the same beat as me, but keep going. Don't forget to breathe. Okay, I'm gonna test your coordination. We are going to step to the side, okay? So same hand as leg goes up and out. Hand as leg. Yep. A nice little recenter. And then once you got, speed it up, go to the leg. Step, touch, step, touch, step, touch, step, touch. Keep it going. And don't forget to breathe. Y'all got wonderful rhythm. I love it. Okay, now that we are a little bit more advanced, we're gonna reach across and do a nice little twist. So we're gonna twist and reach. Twist and reach, yes. Yes, reach, reach. And it's okay if you knock your neighbor, it's okay. Keep it going. Squeeze your lower belly so you don't knock yourself over. Get the glutes involved as well, why not? And then we're gonna slowly bring it down. We got the blood going. Give ourselves a little sway side to side. We ready to take on the day? And you see that I can still talk while we're doing this? Yeah? All right, well done. Thank you all for your participation.
Woo! Yes. Yes, we up. All righty. Okay.
You sound winded.
Just a little winded. I think at this time we are going. You sure we need a break? You know who Lisa is? So we're going to ask Lisa Adamson, and she's already introduced herself to you. I know you to be a drill sergeant. Yes. So I'm just going to ask you to go a little easy on some of us because some of us will not catch our second wind. We will need a defibrillator in a minute.
Hey guys, thanks for that. That was great. And it only takes a little bit of movement, okay? As Dr. Weasley said, in regards to 150 minutes a week. Have you figured out how long that is in your week? 30 minutes each time, okay? Times 5. We all have time for that. We all really have time for that. When I was talking to Violet before in regards to exercise as well, the way we sit, the way we stand, but also when you are in an evening watching TV, during a commercial break, exercise. Get up, sit down, stand up, sit down. Okay, one of the main things I find with a lot of my clients, specifically as they are older generation, is when you are getting up out of a chair, you put your hands on the chair to help you up. I also see it in 30-year-olds and 20-year-olds. We shouldn't be, when we're sitting in a chair, have to put our arms down in order to get ourselves up. Not at all. We should be able to be doing that freely. That's something that you should all be practicing every day when you're sitting at your desk, if you're at home watching TV. So literally, as you're sitting down where you are now, take your hands off, okay? And don't use your arms, use your legs. We were given them to stand up, okay? Keeping that core nice and tight and back down again, okay? Just do that during your commercial breaks, okay? It will strengthen up your legs. It will raise the heart rate a little bit after watching a movie for 2.5 hours, okay? Teach yourself to do that rather than sitting down and automatically hand on the desk or hand on the chair to push yourself up, okay? That's one key you can think about doing and changing with everything of exercise in that way, okay? Make sure you can do it during the day in the office. How many people sit at a desk here during the day in an office? Yeah. How many monitors do you have? 2, 3. Most people now have 2 or 3 monitors. Where did we go from 1 to all of a sudden 3, right? Not to mention the fact that when you're sitting there as well, you have this forward flexion, okay? And now, literally, in the New England Journal of Medicine, will say it's called forward flexion syndrome, okay? Right? Sit upright. Sit upright. When you do that, okay, your core activates and you get better stabilization in the lower lumbar, okay? Also, as we get older as well, we go in this kyphotic, yes? Rounded shoulders. You look at our younger generation of today with their phones, they all sit here, there, with their round shoulders, and they are kyphotic with this. So as they get older, they're going to have a lot more weakness, and they will have horrific back issues. Always sit up tall. Think of your skeletal system. When you are moving, like we just moved as well, keep up tall. I say to my clients, your belly button, okay? It's a button. Press it in, pull it in, tighten it up. As soon as you do that, your core engages, not just anterior or inside, but also posterior. It's all of things like that that you want to think about. You see how much better you're sitting up right now? Yeah, sit up, sit up, sit up tall. Engage everything. At your desks as well. Think about ergonomically how you have your desks set. When you've got 2 or 3 monitors, how are they set out? Where is your chair? How tall is your chair? How many people now have standing tables? Standing? Nobody in here. Shame. I will come to your offices and I will work that out for you. Okay? Standing desks, super important nowadays. You don't have to stand for the 8 hours, but you should be standing. My job all day, I am standing all day. I eat standing up. The only time I sit down is when I get in the vehicle to drive back home from work. I stand up all day and I stand in my power stance. Okay, so you should be all when you're standing, when you're sitting, think of a power stance. But when you're at the office as well, just check ergonomically what your setup is. Pull your chair in closer. The further away you are, the more you slump, right? There, and then you're turning to one side. Your keyboard is here and you're turning one side. And then you've got another monitor there, and then you're turning there. This excessiveness, okay, this rotation, too much, too much, too much. Okay, so just that's another type of lifestyle you can change, okay? In regards to your exercise, it is key. We were born to move. We were born to run. That's why we have this hinge joint here, okay? That's why we have the hinge joint there. That's what we're born to do. You've got to keep moving. If you live in a if you live or work in a multi-story, okay, even if it's 2 floors, okay, use the stairs. Use them, okay? Get up every 30 minutes. Go down the stairs, even if it's 2 flights, and then come back up again. This, as we spoke before, is a pump, okay? We have to keep it pumping the whole time. Keep the valves open. Okay, go back as well. What you can do if you're going back up the stairs, take 2 at a time. Or go sideways. What you can do if you're going back up the stairs, take 2 at a time. Or go sideways. I know my husband says I repeat a lot, but that's I can hear myself. So, you know, just think of all these different things you can do. Exercise, again, we were born to move. We're not born to just sit there, kyphotic, increase everything, you know. And our younger generation with these phones and these iPads. And before, again, when we're speaking about the age of seeing what age to start screening our younger generation as well, parents, don't give your children phones to play on. We all played outside, yes? Okay, we all did that. And when I have clients who say, oh, you don't know how difficult it is nowadays to bring up children, it's no more difficult than bringing mine up. Okay, I just never gave them a phone to play with or an iPad. I mean, I've got a 27-year-old and a 22-year-old. Okay, my daughter was 19 when she got her first iPad. You don't need to give a 3-year-old because you are teaching them bad habits in order for them to sit down too much rather than getting out there and playing, which is what we all did. Okay, we've got to make ourselves move a bit more. Do we want longevity? We do, right? We want to, and we want to be able to go through life specifically with as little ailments as possible and just that health. Same as the 103-year-old as well. Okay, I recently chaperoned an 83-year-old to Puerto Rico for cancer treatment. She walks everywhere here. Everywhere she walks here. Everywhere. And she is very, very strong because that's all she's ever done is just walked. She's never relied on anyone for cars or anything like that. And she also eats a lot of root vegetables. Okay. Now, again, we can go back to that cancer issue and food. And I think it was you said that you had a healthy lifestyle and you still had the issues. Again, you know, are we born with it? Chicken before the egg. That type of thing. All right. I'm not going to get you to do any high intensity stuff. Don't worry. Don't be scared. Okay. But also one other factor as well regarding exercise is impact. 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 Okay. We all should be doing impact work. Okay. Doesn't mean to say you do hard impact, but for bone density and strength. Okay. As we get older. Okay. Specifically, women during menopausal age. Okay. Perimenopause, menopausal age, 50s and above. Okay. We end up getting more or less weaker bones. They can collapse. Again, in this, do impact. Okay, 10 jumps per morning, every day. Okay, we'll also raise the heart rate as well. Get the pump going, okay? It is a muscle, the same as a bicep is a muscle. This is a muscle, our brain is a muscle. We have to really think about changing all of our lifestyles. Okay, in all of those aspects, okay? Once again, the 150 minutes, okay? It's only 30 minutes, 5 times a week. And there are 7 days in a week. We've all got that time. You also don't have to do 30 minutes straight through. Do 10 minutes at one point. Do another 10 minutes, another 10 minutes, okay? Walk. Where do we live? Where do we live, right? One of the most beautiful places, as far as I'm concerned, in the world. It really is. Go for a walk, go for a hike. It is beautiful here. It really is. Trellis Bay, West End, North Shore. Just get out and move. Do all of that. We want longevity. I mean, it does put strain on our health services, obviously. Okay, right? You know, and NHI, sorry. However, it also will take the strain off NHI and our health services because we will have less ailments. Right? Okay, all of that. Okay, so just always keep thinking about it. And we say, you know, oh, I can't be bothered. I can't be bothered. I can't be bothered. But again, just think, right, you know what? I'm just going to walk from here to there and then back. And by the time you do that, your endorphins have kicked in, right? And then you feel, oh, you know what? I feel really good. I'm going to do another lap. Okay. Oh, I feel really good now. I've got a bit of a sweat going. The same as what we just did, the exercise. You all were laughing. You were all brightened up. You're all sitting upright again. Those endorphins, let them kick in. That's our natural drug. And that's what we want to be on. I understand as well, I know with certain ailments that we have to take particular medication, but your endorphins are our natural drug in order to keep moving. Okay, stepping up and down a step if you don't have that. During COVID was horrific for everybody when we were all on lockdown, but you can still find a space to have moved around. That set us back quite a bit, okay, because of that. But you can still find space and find the time. It doesn't have to be full on 30 minutes. I don't have time. Yeah, we do. Yes, we do. Break it up, break it up, break it up. Think about everything you have at home. Like, again, I was talking to Violet. When you're standing there and you've got the kettle on, stand on one foot. Core tight, stand on one foot. Because as we age, our balance decreases. Okay? All right, we'll find that we're falling a little bit more, tripping a little bit more. Okay, get that balance. Use that core. This is your steering wheel right here. That's your steering wheel. When you're driving, you hold the steering wheel. You let go, you're either in the bush or the sea. Okay? Anytime you're sitting, you're standing, you're in the supermarket, this is your steering wheel. Hold on tight to it and be amazed of how that works. Stand on one leg. Even if you're on the phone, and I know how busy you are, but even if you're on the phone, you've got on the speakerphone, just stand on one leg for a little while. Core nice and tight. Stand on the other one. Okay? Anything like that, just to keep moving. Again, I'm not going to give you any high intensity stuff. Okay?
Or go sideways.
I know. My husband says, who is that that's mimicking me? Okay. Any questions or anything about what I spoke about? No? Good. Maybe I've answered everything that you had in your brain already. Yes. Hey, Doc. Oh, you can find me anywhere. Just go around anywhere and ask for me. Yeah. I'm no say at Tortola Sports Club. I'm there doing PTs, and I'm also at Castaways CrossFit. I teach spin. When we said about cycling, oh, she's one of my girls. When I said about cycling, so I've been cycling here for 28 years or something, cycled, and have represented the BVI in cycling as well. I still do cycling, go off island a lot. But I teach a spin class, which is indoor cycling. Okay, Damien, how's my indoor cycling spin class? Terrible. Terrible. Kathy comes. Much better, right? Because you feel better. Yeah, so that's good. So, you can get an indoor bike as well, just to keep moving. Or you got these tiny treadmills nowadays. Have you seen these treadmills? Okay, they're literally like not even this big. And you can just walk on them. One of my clients has got that as well. And she said when she's reading documents, she just gets on it and walks. Okay, so just keep thinking about things like that. Bands, anything. Yes. Hi. Yes. Great for circulation because, like when you're on a plane and your feet swell. Yes. Yeah. So, do so many of steps. And remember as well, there's all this thing about steps, 10,000 a day, to get those steps in. We said as well about the watch. Yeah, I'm a big believer in a smart watch specifically. Going back to swimming, when we said about swimming is good. When you swim, your heart rate actually drops. It is really good exercise, but actually your heart rate drops more. So you don't, so unless you are going extremely fast, otherwise your heart rate will go up, but it won't go up as high as if you are on land. So swimming is a really nice calming form of exercise as well. And it's fantastic for the joints because of the resistance. And especially if you do have arthritis, etc., it is really good. How many people go for a sea soak in an evening? Right? Oh, even if you're just underneath, but it does drop your heart rate a little bit, which also can help with stress. Okay. Anyway, yeah. Yes. Yeah. Yes. Yeah. And if you don't know as well, just go, if you feel though you are comfortable in the water, obviously go with somebody or just go where you are comfortable in this. and you can still walk in the water. Just walk. It's so good for here and for balance as well and core strength. Okay. So anyway, I will leave it at that. Any other questions? No? Good. Thank you. Thanks, Zoe.
Excellent. Put your hands together again for Lisa. And reminding those of you that may have not registered as yet for this evening's symposium, that you can still do so. Please go and see one of our Rotary family members at the Rotary Family Desk to secure your space. It is $100, and the venue is Maria's by the Sea. So obviously it's dinner, but you also get some good information. And we at least have 3 of the panelists that are on top here, including our very own DG Bill. At this time, I'm going to ask for First Lady Ella, who is a general practitioner, to come to the mic. And I also want to, while she's coming to the mic, I want to recognize our AG, Rosemary Flax. So what's going to happen next is we're going to have First Lady Ella. Then we're going to have the panelists that will actually give their final thoughts. And because we do not have a fully functioning studio, I'm going to ask Dr. Whitley to put us in a little more hit while the elevator goes up and makes a bit of noise so we can make sure you get fed. All right?
Hello, everyone. It's indeed a pleasure to be here. And I would like to commend and congratulate the organizers because we are so busy getting our iPhones, doing everything else. But when it comes down to sitting down and talking about the things that really matter, we seldom, find the time. So I really want to congratulate the Rotary family and all the physicians here in the BVI for this wonderful symposium. I know we all want to live to 103 and we all want to be looking great at that age. We all want to be reading the books to the grandchildren, taking them to the park. But I am here to tell you that starts now. And one of my passion in general practice is preventative medicine. And so we are plagued with non-communicable diseases. We're talking about hypertension. We're talking about diabetes. We're talking about these that came just on our plate by virtue of who our parents were. We can't do anything about those things. And I'm thinking about those risk factors that we can't modify, one of which is our race. And so it is a good initiative to sit and talk about these things. We can't change who mommy was or daddy was or how we were fed as a child, but starting today, we can stop and think about the things that will help us to get to 103 looking good and to the state of our physiotherapist there and looking so great. And one of the things is just stopping and thinking about what are those risk factors that I'm able to modify. Dr. Wheatle had put it in perspective earlier when she spoke about smoking, spoke about let us move a little bit more. Let us, be mindful of the things that we're putting in our bodies. And in Jamaican saying, we say it's not the same day that the leaf falls to the bottom of the bucket that it rots. It's going to take some time. So we need to think about that as we make changes in, just about how we live our lives. I want to also emphasize that exercise is really number one. We are meant to get up and go. And that is something we can modify, guys. And it's really not that hard if you think about it. Let's park a little bit further from the supermarket store. Let's, do a little bit more walking and just get engaged. I find very, very, very often in practice that patients, they want you to give them a tablet for everything. Doc, I want to lose weight. You said I'm 30 pounds overweight. What about Ozempic and Wegovy? And I said, what about getting up and moving? We have become accustomed to getting things done quickly right away. And sometimes those quick moves, those right away moves will not serve us well for the future. So let's go back to basics and let's get moving. Let's watch what we're putting in our bodies. Water is usually frowned upon by a lot. If you take someone out for dinner and you serve water, so where's the juice? Where's the fruit punch? Where is the red wine? But I just want to encourage us to stop, think, go back to basics. And also we have to teach our children.
we have to teach our children the healthier way, the more acceptable way. So a tablet may become necessary, surgery may become necessary, but until we get there, there are things that we can do to keep our bodies healthy. And of course, dieting, exercise, number one, sunlight. We live in paradise. We should really capitalize on that. So I really want to congratulate you for taking the time to come and to listen as we share and as we really resolve to teach our children a better way. A lot of us grew up on fritters and oatmeal porridge with condensed milk and Johnny cakes with ackee and saltfish and a lot of oil. But we now are sitting to think about there's a better way to do that. So I just want you to stop to think and to resolve that. Yes, I want to get to 103, but I want to do it well. I don't want to be ailing from everything in the book if I really do have a choice. So thank you all. And remember, a tablet is important, but we have the remedy, which is just lifestyle changes that can get us to 103 and doing it well.
Excellent. Thank you so much, First Lady Ella. We were going to buy a bit of time, but I'm happy that Back to Life, they are ready now for their demonstration in terms of ensuring that each of you, before you leave here today, are going to know how to conduct CPR, as well as learn at least the basics in terms of using the AED machine, which, to be honest, is very simplistic. Okay, so see, gone are the days where we used to play the dummy. Now we.
So just to give a bit of introduction, what we're going to do here is just show you something that as community that you could learn to do. And it's supporting the program that the Rotary are looking at in terms of resuscitation and defibrillators out in the community, because if we can get to people early and shock them quickly, then we stand better chance of getting them back. The key thing is not to forget anything of what your panel have said today. Prevention is better than trying to resuscitate somebody. So prevent yourself getting there in the first place. But unfortunately, that's not always the case. Thank you very much. That's not always the case. And so we're going to give you just a very short demo to show you how to resuscitate somebody in the community. And if you're lucky enough to have an AED nearby, which is a defibrillator, we'll show you how that works. And you do have some around in the community areas, in gyms and things like that. Okay, so just bear with us and we'll take any questions at the end.
Hello, you all right? Can you hear me? You're right. Come on, open your eyes. Can I have some help here? Somebody to that. Hi, I'm full of calls. You all right? This person's not breathing. Do you know whether there is a way in? I do. When you bring it, can you phone the emergency services and state cardiac arrest? Tell them where we are. Okay, we'll do.
Please. Save me, white uncle, please.
We're trying.
Chair open.
Yeah, I'm going to work around you.
Look closely at the picture on each pad.
Okay.
Peel off the pad labeled 1 and do not touch.
Okay, stand
the
clear,
patient.
please.
Analyzing heart rhythm.
It's analysing. Stand clear. Everybody
Shock
away.
advised. Stand clear.
Stand clear,
Press the
everybody
flashing
clear,
orange
shocking.
button.
I'll take
Shock
over CPR for
delivered.
you. 1 and 2 and 3 and 4 and 5 and 6 and
Begin
7
CPR
9 and 10
now.
and 11 and 12 and
Press the
13
flashing blue I button for CPR or stop.
21, 22, 23, 24,
Reanalyzing heart rhythm in 2 minutes.
30. Good ventilation. We'll go for 2 minutes. 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13 and 14 and 15 and 16, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Just went up. Good ventilation. And 2, 3, 4, 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13 and 16 and 17 and 18 and 19. 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 2 breaths, hold it there. In a minute, it'll come up again and it will advise shocking. And that means 2 minutes has gone by and we will then deliver another shock. And we will
Reanalyzing heart rhythm in 1 minute.
I haven't got the energy for another minute. But it's very exhausting. So normally somebody would compress for 2 minutes, and when you go into that shock, then we would swap over again. And that's an important part of the whole scenario, so that we make sure we don't get too tired, because we might have to wait 10 minutes, 15, maybe longer for the ambulance to arrive. You have a big island, and it sometimes takes a bit of time to get to you. So that was a demonstration of how you can do immediate resuscitation. If you don't know how to do it, but you've seen this demonstration, do something, because if you do nothing, they will die. If you do something, it might help. So always try. Don't be afraid of doing something. We'll take questions, if there are any. Yes, Roger.
Thank you. So if this happens in a community and someone is uncomfortable giving
So what I noticed was that you guys were giving, 30 chest compressions and then 2 rescue breaths, right?
Sure, yeah.
So what if you're in a community and I don't know this person. I'm not going to be giving this rescue breath. Are there any alternatives that we can do?
Yeah, absolutely. If you're not happy giving rescue breaths, there's a couple of answers to this, I think. One is, if you are worried about giving rescue breaths, then carry some sort of device with you. We on our keys at home, we haven't got our cards here, couldn't get them in the plane, so we don't have them with us, but we have little key rings and we have little face shields that we can use to protect ourselves from infection. But if you are really uncomfortable, and sometimes maybe you come across somebody and it's not a very nice situation, then do compressions. Absolutely do compressions, because you can. And the ventilation is very important, but the compressions are very important too. If they have a sudden collapse, they're going to have some oxygen in their system, but it's not going anywhere until you start pumping their chest. So start pumping, and if you don't feel like doing ventilation, you don't feel you can do that, that's okay. The real challenge, though, is, and in answer to your question, is most of these things happen in the home. Unfortunately, most of these things happen with people around them who know them. So the likelihood is, in many cases, you will be prepared, because unfortunately, it might be somebody you know well.
Thank you. Sure. Could you elaborate a bit about whether or not the person may have food in the mouth or the position of the neck, just so that...
Sure. So in terms of when Helen did her first assessment, she goes down and she gives a look, she opens the ear, but she's also looking in the mouth for any food. You pick food out. If you see something in the mouth, pick it out, but don't blind finger sweep. The challenge that we have with those is that, potentially, if the patient isn't, at that point, you're not sure whether the patient is in cardiac arrest or not. They could bite you. That's one thing. It's a good reason not to do it. But the other thing is not to push it down further, particularly in children, where it could go down further and further block it. So if you see something, you block it out. If it's fluid, turn them on their side or get their head on the side and allow that fluid to drain out before you start? Good question. So once you've checked that airway, then you have to open that airway, and you open it up with a head tilt, chin lift, and that will allow the air to go in. So clear it if it required. The only thing I would say is have a cursory look. We used to find in the guidelines people spend a lot of time looking in the airway, and then time was passing before they got onto the chest.
I think a simple description of this is to think about coming out on a nice morning, sniffing the morning air. That's the position you're aiming to put people's
Put the
head in
head,
to
yeah,
get their airway
absolutely.
open.
Yeah.
If you're doing chest only resuscitation, how many compressions do you do, and do you take a break in between? Could you explain that?
Okay, so compressions from the guidelines that you're now following for the community is 30 compressions to 2 breaths. In the main, if you're not going to do ventilation, if it is really that kind of situation, you decided not to just completely continue with compressions, that would be the most effective thing that you can do at that time. But bearing in mind that if you haven't got that call for help out, you're not going to be able to last for long. So it's critical that you get the call to the emergency services or send somebody to do that, and then tell them to come back and tell you that they've done it, because you won't last very long if all you're doing compressions. If you can't get a defib to them, then it's very difficult to get them back.
And know where your community defibs are.
Joe, should we challenge the Rotary Club to also give the disposable face shield along with the AEDs as well?
I think probably the answer is yes. It's a great idea, because the other thing you can do with the face shields is you can put little prompts in there. So somebody who goes there and thinks, I forgot my training, you can put a little prompt on there. You can design something that has a face shield and a prompt that reminds them of the first step. So it's a great suggestion.
I have another question. We've become a very litigious community. What happens if I botch my attempts to resuscitate? Am I exposed?
It's always a situation that we've had over the years about litigation, but I would always come back to, if you do nothing, they die. If you do something, and that would be where you sit, that in the community setting, you've attempted to say your ethical, your moral standing is that you made an attempt to save a life. It would be very unlikely that anybody would be successful in litigation if you are just trying to save a life in the community. I'm not aware of any. Do you have any in the US where you've had any litigation against community? No. And we haven't in the UK. Nobody's been successful.
I was going to say that I think perhaps litigation may arise in the case where the patient has a specific request that they not be resuscitated. Which does happen in some cases, which obviously would not be known by the person who is engaging in the CPR. So I think the courts would look favorably on that situation, though.
And if maybe you could use the one at the table.
Can you go through, I guess, checking for pulse? Where do you check for pulse?
So
I mean, I did the training but for the sake of everyone, if you could do that. And also, what about the toes in terms of checking for coldness or, are you able to go through any of that?
So
in terms of what you're checking for a while, okay, I'm doing the compression. Yes, I'm doing the mouth-to-mouth resuscitation. But is there anything else that we want to check for to see if we're making progress?
So for diagnosing somebody who's in cardiac arrest for the community particularly, if they're unconscious and not breathing normally, you resuscitate. We don't worry about that pulse. The pulse is something that is very difficult to feel if you're a layperson. It's even difficult for medics to feel at times. But if somebody is unconscious and not breathing effectively, normally, then they need resuscitating. So you start resuscitation. And that's what our guidelines say. If they're unconscious, not breathing normally, then you start resuscitation. All other signs and symptoms become a bit superfluous at that point, because if they're cold, what are you going to do about that? You get their circulation going and you get them resuscitated, then you can warm them up. But at that point, the most important thing is, are they unconscious? Are they breathing? And they're the two things that you look at. You can lessen the concern about the pulse. It's something that we look at more in the hospital setting, not in the community.
What's the difference? So a question in the back, what's the difference in terms of hand positioning between an adult and if we were trying to revive a child?
Okay. Hand position, not really much different in a child. Helen will demonstrate. Found it as a child. So if we were doing a child, we'd put a hand in the same position, but we would use one hand only. It changes when we do an infant. So an infant is anything under 1 year of age. And then we circle our hands and we put our thumbs around the baby's chest and compress that way. But when you get your community training program going, you can do all of that and have a go. And that's what I would really advocate, that you find a way with the Rotary Club, potentially to look at a community training program. There's nothing more successful than actually doing it for real on a mannequin and having a go and asking the questions at the time. So child, same position, but one hand.
Are there any other questions? Okay, thank you. Sorry, please put your hands together for an excellent demonstration. You want to
If you come across a community AED, but you've never been trained to use it, that doesn't stop you. Just turn it on and follow the instructions it gives you. And as long as you make sure nobody is touching the person that's collapsed when you press that shock button, you are doing the right thing. So don't be afraid to use them.
All right, thank you so much. Put your hands together one more time. And because this is a full-bodied experience, I just want to very quickly, okay. I just want to very quickly highlight for you Sapphire Health. Just give a quick overview before we go to our panelists to conclude, to do the wrap up. So tell us a bit about what you do and what you offer.
Good afternoon, everyone. So we are here from Sapphire Health. We are a private laboratory. We offer all types of laboratory testing. Today, we are highlighting our metabolic risk panel. So it includes vitamin D, lipids, and apolipoproteins, as well as A1C and insulin. So the combination of all these tests give a great, oversight of your metabolic health. And the apolipoproteins and the lipid particularly are a great predictor of future cardiovascular risk. So we are also offering 10% off if you come in with this card and you want to do this test. You do not need a doctor's request.
All right, thank you so much. That's Sapphire Health. And over here we have Mutual Insurance.
Good afternoon. It's a pleasure being here. Thank you guys for having us. We at Mutual Insurance, we offer medical insurance. It's tailored to suit you. It's not like a one-stop shop and we tailor it to suit your benefits, what you need. With this health insurance, you can have one condition and you can still be insurable. So you can, if you have diabetes, we're not saying no. If you have hypertension, we are not saying no. Once it is controlled, we can insure you. So you guys come over, check us out. We're here to help.
Excellent. Thank you so much for that. And of course, we want to recognize, as we did earlier, the BVI Rotary Family Desk that just has some information, and they continue to be grateful that they're able to help out in such a worthwhile cause in terms of partnering with the BVI Health Service Authority to pull off this symposium this morning, as well as the event that's happening this evening between 6 to 9 p.m. So don't forget, for those of you that do want to attend the dinner, we have our 4 illustrious speakers coming out this evening. It's also an excellent opportunity for accreditation for our medical professionals. yes, our CME credits. I see Dr. Bill is calling me over.
Men, if you want to know the connection between erectile dysfunction and heart disease, please come out later.
Wow, yes. Heartbreak Hotel, and before the 14th of February. Let's get it corrected. Let's get it sorted out. All right. And of course, I was looking for Nurse Roach, but Damien, I'm going to put you on the spot. I know earlier they were here and they still continue to do some levels of testing. So tell us a bit about that.
Yes, absolutely. Our community health team, they're here. They're doing blood sugar, blood pressure checks. You can also get your flu vaccines today. Please don't leave if you have not had your flu vaccine yet. We are seeing an increase in influenza cases across the territory and certainly in the region. So you want to be protected. Also, I must add that you don't even need to wait until you need to see them to go to them. Our community healthcare team is in the community, and you can visit them at any of our outstation clinics, and they'll be happy to provide service to you. I also want to add, as it relates to the defibrillator and the CPR training, that the BVI HSA has just introduced a training program, where we will come to your facility, your properties, and we can train your families, your teams, just so that they know how to use the defibrillator and be able to. It is not for free. No. The Rotary sponsored one is for free, but those are going to specific locations identified by the Rotary family. Again, let me take this opportunity to ask everybody, invite you to give the Rotary clubs of the BVI a round of applause. The Rotary family collectively continue to support healthcare across the territory, and they have been a wonderful partner, certainly for the BVI Health Services Authority, and we're extremely grateful. And just to find out today that you're now going to add the disposable device to the project, that is excellent. But again, support the community table, learn from them, hear from them, meet them, and get your checks done today. Remember, early intervention. Thank Uno.
All right, thank you so much, Mr. Grange. So we are going to, unless there are any other questions, and I know Dr. Bill piqued a number of your interests in terms of, the reality is we live in a culture where certain things become taboo, but it's a major component that does affect not just your health, but the way that your family functions. And so if you can, show up tonight. It's $100, 6 to 9 p.m. And we're going to ask the questions that maybe certain people were afraid to ask in this room, maybe because it was too open, right? And at Maria's by the Sea, it's a little more, I want to say intimate, a little bit more closed, which will really allow us to sort of drill down. We've heard so many things today that, to be honest, really opened my eyes, because where we were thinking it was just obesity, hypertension, and all of that, and to realize from the womb, we almost end up in the tomb. So, so it's important. The more information we have, the better prepared we are to be able to mitigate. So I'm just going to allow for our panelists to leave. So you did have a question? Let me run over 1 second. Oh, 2 more.
Thank you. I just wanted to ask whether there is any provisions for persons. We know Dr. Google is alive and kicking. Yes, we check often and we say, I wonder what if I could have this or that. I would love it if physicians would be more open, or even laboratories be more open for persons to go and say, I want a check for this or that or the other. Just to clear my mind. So many of them says, we're not going to do it unless we get something from the doctor. If I'm willing to pay and leave NHI out of it, isn't there any opening for me to be able to request a test to alleviate my concerns? And you might, reduce, so often these things that people might catch it way before time. I think it's something that should be lobbied for, and I think laboratories should be open to that opportunity.
I do have a response. Sorry. So you can do that in some places, but the reason why I personally advocate for you to have a chat with the doctor is because one, you get the test results back and you might not necessarily be able to interpret them, but also because your lifestyle factors are so multifaceted, it's an opportunity for us to find out what else is going on. So I often have people who come in and all they want is their cholesterol checked. But when you actually take a detailed history, they're not sleeping, they're not eating correctly, something is stressing them, and there's all these other things that we need to look at in addition to the cholesterol.
But she highlighted something that I'd actually meant to ask earlier. And so I want to use the opportunity now. We got ChatGPT. We have Google. And so a lot of us have now become we've become socially diagnosed. What are the dangers with that? Or maybe there are no dangers.
There are dangers with it because not all of the information is correct. But I will say this, one thing, especially TikTok has helped, is I will be telling my patients the same thing over and over again. And some random person on TikTok tell them exactly the same thing. And all of a sudden they're telling me like it's new information. So I would always say get it validated by a professional, but there's no harm in looking. Just keep in mind some of it might not be accurate.
And to your point, it may mean that the approach that is taken in the fight against cardiovascular diseases may need to take a different approach in terms of the way that we sensitize the public. So sometimes you can't come mainstream media to try to attack a situation that the culture determines might need a different line of defense. And so I'm going to task, since I want to Rotary thing, I'm going to task all of you that are here, and all the fighters, the survivors, and all of you that exist in this ecosystem, that maybe you do need to work a bit more in terms of working those social media angles, the TikToks and the like, to get your information out to the masses. So Dr. Bill Aiken, even as you reference the fact that this is something now that you're going to be pushing whole throttle, not just for this Rotary year, but for the next Rotary year, maybe I know that there's a lot that has been done in the scope for social media, and most certainly some attention could probably be placed there. We're going to meet the people where they, oh yes.
Following up on the comments about social media, this is with respect to women's health. I'm not short. So when you look on social media, you see a lot of pushes for, especially in the menopausal discussions, for strength training, and also persons putting down cardio exercise, and even some trainers saying they don't like cardio. So from a trainer's point of view and a cardiologist's point of view, how do you advise these women who are being encouraged to do a lot of strength training and not to do cardio anymore?
Ouch.
Oh, thank you. Okay, so the two actually complement each other. It's an excellent question, but the two go hand in hand. And this is recognized by most guideline writing bodies. So if you look at the guidelines, exercise guidelines from the American College of Cardiology, again, and the American Heart Association, it's quite clear that the recommendation is 30 minutes per day minimum, up to 5 times a day, or minimum of 150 minutes per week. Plus you should have at least 2 days of resistance exercising as well, which means essentially weight loading exercises. So the two are thought to complement each other, and so there is no, it's not one or the other. It's actually both.
Wow, we ain't doing good at all. My numbers ain't nowhere near there.
Hi, good afternoon. Hi, I'm Dr. Miguel Enrique Sewer, and I'm vouching for social media. My PhD was on organ donation and social media. I'm the only liver transplant patient on the island. I've had it for 38 years. And I came back to the islands about 3 years ago to kind of help out the transplant recipients we have on the island, plus the diabetes and the dialysis patients that we have, to see how we can help them going forward. But the other thing is that I was a paramedic for 10 years in shoot 'em up Los Angeles. I was a drug rep from Merck, and I worked other medical institutions. And we learned from the strides that it's moderation and consistency that helps us.
All right. Thank you so much for that. Salient points. Are there any more questions from the floor before we start to wrap up? Any burning question, Damien?
Zoe, I'll just like to add, as it relates to social media, Dr. Gordon is also part of our social media outreach with our Doc Says and our Med Minutes, and we also have Health Watch from the BVI Health Services Authority. Only thing I would ask is that the Rotary family help us to amplify the message by sharing our videos. Thank you.
That sounds doable. Beautiful. All right. And so as we are bringing and close to this morning's symposium, we're now into the afternoon. I'm just going to have you give some last thoughts.
Well, thank you very much again for having me. But boy, I have more than a few thoughts, and we can follow them up tonight, this evening. All positive. I am extraordinarily impressed, and I learned more than I gave to you. I'm positive. What I learned is the sense of community that's here, that I see in front of me, and the enthusiasm to come together as opposed to dividing us apart. And I want to just thank you for giving me this experience. I also was extremely gratified to see the breadth of the conversation and the questions, from prevention to early recognition and screening, to then also there's a role for treatment, including, and we talked about it, diabetes, hypertension, dyslipidemia. We also touched on end of life as well. We're all aging. Hopefully we're going to be aging gracefully. I was talking about social media. I don't do social media, but somehow it crossed my path. The new target for life longevity is now 150 years old. I went, no, don't do that to me. No, but that's now the new. I don't remember what it was. I don't remember which society. Completely legitimate society. It was from my country, I believe too. But 150 is now a potential target, and centenarians. That's going to be common, not the exception. So kudos to everybody in this room, because I think we added about 2 or 3 or 4 more years here in the BVI just from this morning.
Okay, I echo those sentiments. Just to add on a positive note as well. So I think there's been a lot of discussion around cardiovascular disease and just how prevalent it is, as well as the implications in terms of morbidity, mortality, all important messages. However, it's important to note that heart disease, in large measure, is preventable. It's preventable if we take the steps which we need to take in terms of controlling our risk factors, ensuring that our blood pressures or blood sugars or cholesterol or weight and our lifestyle is consistent with the practice of promoting health and prolonging life. So although it's a devastating and difficult and traumatic experience for many persons, there is a light at the end of the tunnel. It is preventable if we take the appropriate steps. So know your numbers, know what your normal blood pressure should be. 130, 80, less than that is a target. Your blood sugars, fasting between 5 and 6. Okay, your total cholesterol varies, your LDL, bad cholesterol varies depending on the population, but aim for less than 2, you should be good with that, and a BMI of 18 to 25. So if you bear those numbers in mind and you strike for those, you are putting yourself in the best possible position.
The pleasure was mine to be here. Thank you for having me. And also the pleasure was mine for being here. Thanks for having you, that I can share my experience with you. But also please focus, as the doctor said, on your what you're doing, exercise, try to eat proper. Sometimes, we cannot, and also pray and trust God, because He is the one that actually I could say me too, because I had 2 miracles that He assisted me with. And also keep your stress level as low as possible, even though it can be difficult if you have family issues or different matters, but try your best.
I thought Miss Smith was going to say, make sure you have your doctor's number on speed dial. Yeah, so I want to thank everyone for coming, especially my two patients, giving their experiences. And, we thought that would have been a good way for the community to relate to, rather than hearing all these, these jargons from medical professionals. So before I presented that our mortality rate was about 50%, right? So I'm going to challenge everyone, right? So we have all this information. Can we aim? We may not be able to take it to zero, but can we in the next 4 years cut that to 25%? Can we aim to do that as a community? Okay. All right. So we'll do that. All right. Thank you.
Well, thank you so much for the invitation to be here today to share a part of my success story. I just want to encourage all of us. We can do it, even if you're diagnosed with anything. My friend over there says, trust God and pray, and that is the key element to it as well. So let's go out and continue to be healthy people. Remember to go and get that pressure machine, a very good one, in your home. Get a diabetes kit, and you can check yourself daily or every other day, but at least you know the range, and you can say, well, boy, it's up here today. I think I need to go and see my doctor. And as I said to you before, besides my King James Version Bible, this is my next to record everything that's happening to me on a daily basis. So if I have to go to the doctor, I can say, I open this and see, doc, look at there. That's all of what was going on. And they can make a proper diagnosis. So thank you so very much, Dr. Miller, for having me here. Rotary, thank you very much for what you're doing, and God bless you.
I just want to add that Mrs. Rima, she's excellent with her blood pressure diary. She prefers it to be, write it in her book, but you have apps if, anyone who is tech savvy. So, those are options, but she takes it every time she comes to clinic, and I can go back for months and see what her log is like. So excellent. Yes.
I certainly want to join with everyone in showing gratitude for being able to be here today. I think it was an excellent conversation that we've had. I just want to leave you with 3 points. As we try to lower the incidences of cardiovascular diseases as it relates to nutrition, that we want to prioritize fiber in the diet. We also want to increase our healthy fats. We want to lower or reduce the amount of sodium that we're consuming and increasing potassium, as we learned today as well, and to make small, sustainable changes over time. Sometimes when we try to make lifestyle changes, we go hot and heavy really, really fast, and then we get frustrated, and then we don't continue. So small, sustainable changes over time really does matter. I recently had a client. She came in and her lipids were elevated. She was in the pre-diabetic range, and she said, Miss Matthew, I don't want to take any medication. Can we do this lifestyle? And this was 3 to 4 months ago. I saw her last week. Her A1C is down. Her LDL is down, her total cholesterol is down, and we just did diet and exercise. So it is definitely possible with small, sustainable changes over time. Continue to eat well and be well.
Thank you all. It's been a lovely morning/afternoon. You've got a lot of information from our very esteemed panel. And I just want to remind you that you don't have to consume it all in one go. You don't have to do everything today. If you have any doubts, any questions, you have your staff at your clinics that can help you, people like Miss Matthew, people like myself, who will hold your hand through every step of the journey if we need to.
All right, excellent. Put your hands together one more time for our illustrious panel. For the BVI Rotary family, BVI Health Service Authority, and put your hands together as well for the different entities and businesses that came out today to be able to facilitate. And of course, for yourselves, for making the decision to come on a Saturday, right? Because this is the start to putting your health in your own hands. And you're going to pay as much attention to yourself as you do to your vehicles. The vehicles start to clunk up. We already know one time we're taking it into the mechanic. When it comes to ourselves, we tend to be too lackadaisical. All right. And so we already heard, I'm not going to repeat all of that. So I want to thank you. God continue to bless you. We have had a number of challenges issued today. Just know, and I think it's okay for me to speak on behalf of the BVI Rotary family when we say that we take what we do with the community serious. And so when you ask, most times we answer. So I can assure you that all four of us will be taking a look at how best we can facilitate with the shields. And in saying that, I'm going to ask for the Assistant Governor, Rosemary Flax, who will give the, yes, sorry, the closing remarks. And while she's coming to the mic to give closing remarks, let me just alert you to the fact that to my left, we do have a little bits and bats, and I hope it's healthy. Did the nutritionist approve this? Let's not, we're here on a mission.
Zoe, no, this is like your last goal, the binge-worthy time, because after today, you're going to do better.
And our beverages are situated to the back. We thank you so much for joining us, AG.
Thank you very much for putting me on the spot. They love to do it anyway. But anyway, this morning we did a tour of some of the projects. The district governor and his lovely wife and some of the other Rotarians did a tour of the projects we have been doing here in the BVI. And I can tell you, our district governor is so impressed that he's taken back the ideas, some of the ideas of what he has seen. And today, I am so proud of my Rotarians. At our district conference, when DG Bill talked to us about the cardiovascular disease, I listened well. And my presidents and secretaries, when we meet in our corps meeting, they can tell you that was on the agenda of every single meeting. And I grilled my president over here, Dr. June Samuels, to ensure that she was in charge and she managed all of this with a lovely group of people. And I'm proud of you, Dr. June. You have done well. I want to thank our panelists. I wasn't here for everything, but what I've heard, I'm very impressed. I'm very impressed with the doctors and the patients and how well you are taking care of yourselves. You're listening to your doctors, okay? Dr. Bill, thank you for being here, and Lady Ella, thank you. And to all of you, all of the facilitators and anybody who has had anything to do with this symposium, I want to say a word of thanks to you. I appreciate the partnership we have with the Dr. D. Orlando Smith Hospital. And even when I have demitted as assistant governor, I will continue. You know I will continue. Look at my chest. Look at my chest. I will continue. And thank you very much. And I hope to see all of you tonight. It's going to be fabulous. I'm anxiously awaiting on that thing. Okay, so see you later. And thank you again from the bottom of the hearts of all of the Rotarians and the D. Orlando Dr. Smith's Hospital. Thank you.
Don't forget, we have refreshment to the back. Please grab something. And for our panelists, please, we would love to have a photograph taken also with the district governor.